and meet other related costs, such as convenience fees charged by Huduma centers. Additionally, teenagers who do not have parents or guardians to pay the application fees for them fails to apply for identity cards due to the cost implications. As a result, most young people are not only delayed from timely access to opportunities requiring ID cards, but also the enjoyment of their inherent identity as citizens of Kenya. Honorable Speaker, it's against this background that I request for a statement from the Chairperson, Departmental Committee on Administration and National Security on the following. One, a report on the justification for introduction of application fees of 300 Kenya shillings for issuance of a national identification card to the first-time teenage applicants who do not have their own income. And two, the immediate action being taken to scrap the fees chargeable for the first-time teenage applications with a view of eliminating the prohibitive financial obligation hindering many eligible teens from obtaining the critical identification document. I thank you, Honorable Speaker.
Thank you. Administration and Security. Tongoyo, who is a member of the committee. Majority Leader, tell Direct Administration and Security to bring a response in 2 weeks. Next, Lelmengit Joses, member for Mgwen.
Thank you, Honorable Speaker. Honorable Speaker, pursuant to the provision of Standing Orders 44.2c, I wish to request for a statement from the Chairperson of the Departmental Committee on Education regarding to the recruitment process by the Teacher Service Commission, TSC. Honorable Speaker, Article 232 of the Constitution provides for the values and principles governing public service, which includes accountability for administrative acts, transparency, diversity, and merit-based recruitment. Further, Section 4 and 18 of the Teacher Service Commission Act, Cap 212, require the TSC to be guided by constitutional principles and that staff appointments adhere to the prescribed ratios, including ensuring gender balance, inclusion of persons with disabilities, and regional and ethnic diversity. Honorable Speaker, despite these express legal provisions designed to ensure transparency and fairness in recruitment process, concerns have emerged regarding potential irregularities in the recruitment by TSC. These questions regarding adherence to the set guidelines. Honorable Speaker, it is against this background that I request for a statement from the Chairperson of the Departmental Committee on Education on the following. Number one, a report on procedures used by the Teacher Service Commission in the recruitment of administrative positions, including clerks and other support personnel. Two, a report listing all staff employed by TSC in the financial year 2021-2022 to 2024-2025, including gender distribution, regional representation, and persons with disabilities. And number three, copies of documentations of all public advertisements and recruitment notices issued by the TSC during the specified financial years. Thank you, Honorable Speaker.
Thank you, Justice. Education. Meli, any member of the committee of Education? Yes, Mongina, I tell your chair to bring a response in 2 weeks. Waithaka Mashua, MP Kiambu, you have the floor.
Thank you, Mr. Speaker. A request for statement regarding the outbreak of Marburg virus. Honorable Speaker, pursuant to the provisions of Standing Order 44.2c, I wish to request for a statement from the Chairperson of the Departmental Committee on Health regarding the recent outbreak of Marburg virus disease in the region. Honorable Speaker, Marburg virus disease is a rare but severe illness caused by flying bats and transmitted through human contact and shares similarities with Ebola virus disease. According to the World Health Organization, WHO, the Marburg disease has a case fatality rate of up to 98%. And on 20th January 2025, the government of Tanzania, in collaboration with the WHO, confirmed an outbreak of the disease in Tanzania, our neighbors. This implies that we are vulnerable owing to the ease of movement of persons within the region. Currently, there are no vaccines or treatments for the disease, and management relies solely on early, intensive supportive care. Given our recent experience with COVID-19, there is an urgent need to put in place preventive measures to address this outbreak in the region. Honorable Speaker, it's against this background that I request for a statement from the chairperson of the Departmental Committee on Health on the following. 1, the immediate measures that the Ministry of Health has taken to prevent the spread of Marburg virus disease into the country. And 2, strategies developed by the government to ensure preparedness for disease outbreak, including enhancing early detection systems and health awareness initiatives. Thank you, Honorable Speaker.
Thank you, Health. Chairman, how much time do you need to bring a response?
Thank you, Honorable Speaker. Honorable Speaker, I'll give a response in 2 weeks' time.
2 weeks it is, thank you. Next, Kawanjiku John, member for Kiambaa.
Thank you, Honorable Speaker. Pursuant to the provision
Yes, Ruku.
Mr. Speaker, the Chairman of Health, Honorable Pokose, does not respond to this statement by the time stipulated. I have a statement which has lasted for the last 3 months now, and he always says next week. He always gives next week. Can the Chairman of Departmental Committee of Health be firm on responding to the statement from members, Honorable Speaker?
He has heard you. Chairman, you shall not be heard to keep saying next week. You don't need to respond.
No, but Honorable Speaker, on a point of order.
Yes. Give Dr. Bukose.
I think the member is out of order because when he says he asked 3 weeks ago,
3 months.
3 months ago, 3 months we were on recess, and he needs to understand that his statement lapsed with that sitting. Therefore, he has no statement to ask to demand. And I think the member does not understand the procedures of the House, that is now complaining of a 3-month statement, which lapsed with the sitting of the House.
The better thing is you are a third termer.
Yes.
Mentor him and guide him.
Yes, I will.
Yes, Kawanjiku. Yes, Ruku.
Mr. Speaker, you gave directions here, and I'm not talking about 3 months. It's even more than 3 months since I requested for a statement. No. Mr. Speaker, you gave directions, and your directions are not in vain, unless this house has started becoming a house where directions are given in vain, Mr. Speaker. And the matter is extremely important. Even 1 week ago, I raised the same matter, Honorable Speaker, about the payment of the dues, last dues of those who are affected by COVID-19, as far as NSSF is concerned, and superannuation scheme by the civil service, which the Health Committee should be able to respond. Unless we have stopped being caring to the public, to Kenyans, Honorable Speaker. And the Health Committee should not let down Kenyans. Thank you.
We will not allow them to do so. Check with the clerk. Go on, Kawanjiku.
Thank you, Honorable Speaker. Pursuant to the provision of Standing Order 44-2C, I wish to request for statement from the chairperson of the Departmental Committee on Lands regarding disputed ownership of land registration LL number 209/14582 located in Lang'ata belonging to Wilson Mitumba Women Group. Honorable Speaker, the Wilson Mitumba Women Group is a social group that was established in the late 1980s and in the bona fide registered owner of land registration number LL number 209/14582 located in Langata, having obtained their title on 1st November 1990. However, in 2005, the police evicted the founding members of the group and have occupied the land which was used to build the West Park Police Post. Over the years, the Wilson Mitumba group has staged demonstrations pleading with the police to cede back their land without success. The police are claimed to have been using intimidation tactics against the group, such as incarceration and maliciously prosecuting the leaders of the group with forgery and trespass case, which they have since lost in court. In accordance with the provision of Article 67(2)(e) of the Constitution, the Wilson Mitumba Group sought the assistance of the National Land Commission, which concluded its investigations in 2016. In a letter dated 13 September 2016, the Commission ascertained that Wilson Mitumba Women Group was allocated LR number 209/14582 on 1st November 1990, which they duly paid for on 26th November 1990. And the title was issued to the group on 1st December 1990 for 99 years from 1st November 1990. Honorable Speaker, it is against this background that I request for a statement from the chairperson of the Departmental Committee on Lands on the following. Number one, reason why the police are still in occupation of the said parcel of land, despite the National Land Commission affirming that the Wilson Mitumba Group is the legitimate owner of the land. Number two, report on the status of implementation of the recommendations of the National Land Commission following its investigations concluded in 2016, and specific timelines on when the police will vacate the land and revert it to Wilson Mitumba Group to accord the legitimate beneficial owners their right to property. Thank you, Honorable Speaker.
Thank you, Kawanjiku. Chair Lands. Yes, Wario. You are a member of the committee. Give him the mic. Yes.
Thank you, Mr. Speaker.
How much time do you need to bring the response?
Due to the complexity of the matter, Chair, Mr. Speaker, we request for 2 weeks.
2 weeks. I don't see anything complex in what he has said. Just bring the response in 2 weeks. Yes. Next, John Waluke, member for Silesia. Yeah? Pardon? Use the next mic, Honorable Waluke.
Thank you, Honorable Speaker. Honorable Speaker, pursuant to Standing Order 44.2c, I rise to request for a statement from the chairperson of Committee of Tourism and Wildlife on the decline of performance of tourism sector in the country. Honorable Speaker, tourism is a critical sector contributing significantly to Kenya's gross domestic project, GDP, employment, and foreign exchange earnings. Kenya is renowned globally for the diverse wildlife, cultural heritage, and breathtaking landscapes, positioning it as a prime destination for international tourists. Honorable Speaker, our tourism sector has been experiencing a serious decline in recent years, with marked reduction in international tourism arrival and expansion to the country, Mr. Speaker. Neighboring countries, including Tanzania, Uganda, and Rwanda have surpassed Kenya's in terms of attracting tourists due to more competitive price, including significant low park fees and enhanced infrastructure development. Honorable Speaker, high park fees in Kenya have been identified as a key deterrent to the potential tourists, particularly when compared to similar destinations in the region. The trade undermines Kenya's stability to compete as a leading tourist destination, whereby affecting revenue, livelihood, and conservation of our equal biodiversity. Honorable Speaker, it is against this background that I seek for a statement from the chairperson of the Committee on Tourism and Wildlife on the following. 1, competitive tourist policy, pricing models, and marketing approaches of neighboring countries and other global leads in tourism. 2, the impact of the decline in tourism on the economy. Medium, small, and micro enterprise operating in the sector. Local communities and conservation efforts. And 3, sustainability measure to reverse the decline and position Kenya competitively as a prime destination, as a prime tourist destination. Thank you, Mr. Speaker.
Thank you, Chair Tourism. Kareke. Member Tourism Committee. Majority Leader inform Kareke Mbiuki to bring the statement in 2 weeks. Honorable members, allow me to acknowledge the following institutions in the House. In the Speaker's Gallery, Mabetex Group, Switzerland, courtesy of Honorable Felix Odiwuor, Langata constituency, Nairobi. Next, Kapkisiara Girls High School from Bureti, Kericho. In the public gallery, Kirigo Secondary School from Mbere North, Embu. St. Clair Girls High School from Gatundu South, Kiambu. Honorable Ruku has requested me to give him an opportunity to welcome the school from his constituency. Do so to all other institutions on behalf of the House.
Thank you, Mr. Speaker. I want to take this opportunity to welcome all the schools who have visited this very honorable House to run on the affairs, how the affairs of National Assembly or Parliament are conducted. Mr. Speaker, Kirigo Secondary School is one of the 47 secondary schools which we have in Mbere North constituency. It is 100% day secondary school and which operates in a very harsh environment, which is semi-arid area. And when you look at the performance of Kirigo Secondary School, I am proud as a member of Parliament on the academic improvement which has been there. However, they still have a very huge work, they have a huge task to do. Moving forward, we expect this year they register a very good or considerable improvement in the academic performance. We look forward that one day the schools who are here, they will produce members of parliament to come and occupy the space which we are occupying at the moment. We as your parents, we are investing all what we can, and also the government of the Republic of Kenya is investing in you. So please don't let down the investment which is coming from your parent and the investment which is coming from your leaders, and more so which is coming from government.
Thank you. Enough.
We thank you and we pray for you. Thank you, Mr. Speaker.
Thank you. We'll end there. Tendi Mwale. Member for Butere.
Thank you, Mr. Speaker. Honorable Speaker, pursuant to provision of Standing Order 44.2c, I rise to request for a statement from the chairperson of the Departmental Committee of Education regarding the removal of Professor Amkoa Nangwe as the chairperson of the University of Nairobi Council. Honorable Speaker, on 21st February 2025, the Cabinet Secretary for Education revoked the appointment of Professor Amkoa Nangwe as the chairperson of the University of Nairobi Council. The revocation followed mounting pressure from the university's academic staff union, AUSU, who issued a 7-day ultimatum demanding his removal. Notably, the Vice Chancellor of the University of Nairobi expressed concern on the demands by AUSU, stating that all decisions made by the Council underwent all lawful channels before implementation. Article 47 of the Constitution of Kenya, Honorable Speaker, provides that every person has the right to fair administrative action. Unfortunately, the revocation of the appointment of Professor Amkoa Nangwe appears to have been processed without granting him the opportunity to respond to the allegations. Honorable Speaker, it is against this background that I request for a statement from the chairperson of the Departmental Committee on Education on the following. Roman 1, the specific reason that led to the dismissal of Professor Amkoa Nangwe from his position as chairperson of the University of Nairobi Council. Roman 2, a report on the actions taken by the government to authenticate the claims raised by the university's academic staff union regarding alleged interference in internal operations in the University of Nairobi. And Roman 3, Honorable Speaker, a report on the procedures that were followed by the government, including the steps taken to provide Professor Amkoa Nangwe with an opportunity to respond to the allegations made by AUSU before revocation of this appointment. Thank you, Mr. Speaker.
Thank you, Tendi Mwale. Your Chair Education. DK, what is it?
Thank you, Honorable Speaker. I think Honorable Tendi Mwale has arose what on my statement of last year, which is yet to be responded, on how the chairman was mismanaging the university. And it was very well, and we are happy that finally at least the revocation has been done. So for him to allege that it is the WASU that started the whole thing, I think it is completely out of order. And I'm still waiting for that, for my statement. Thank you.
DK, you are the one who is out of order. Meli. Chairman Meli.
Thank you, Mr. Speaker. Mr. Speaker, the member also is completely out of order. That he raised his statement here, and we did respond as a Committee of Education, and we visited the University of Nairobi, and we found a number of issues And
Order, Meli. He has requested
No.
for a statement.
I'm just-
When do you bring the response?
in 2 weeks' time, I'll bring
You
the
appear to
statement.
be ready. You can bring the response tomorrow.
I'll bring the statement in 2 weeks' time on the issues that pertains to the sacking of the removal of the chairperson.
Okay.
Thank you so much.
2 weeks.
Yeah.
Good. Dr. Bukose, Chair Health.
Thank you, Honorable Speaker.
Karemba and your group, that Kamkunji is illegal. That Kamkunji is illegal.
It looks like a Munyoro village. Honorable Speaker, I rise to make a statement on behalf of the Departmental Committee on Health regarding our recent engagement with the Ministry of Health and the Social Health Authority concerning the implementation of the Social Health Insurance Fund. During the 2025 midterm retreat for members of the National Assembly, held in Naivasha, Nakuru County from Tuesday 28th January to Thursday 30th January 2025, Honorable Speaker, you directed the Departmental Committee on Health to engage with the Ministry of Health and representatives from the Social Health Authority to receive comprehensive responses to the issues raised by the honorable members. The Ministry of Health and the Social Health Authority rolled out the Social Health Authority healthcare services and the benefits under 3 funds. That is the Primary Health Care Fund, Social Health Insurance Fund, and the Emergency, Chronic and Critical Illness Fund, established under the Social Health Insurance Act number 16 of 2003 that was enacted by this House a year ago. This act currently being operationalized by the government. Access to SHA healthcare services and the benefits being offered by SHA was rolled out on 1st October 2024. Honorable Speaker, members of the National Assembly raised concerns regarding the delays and the caps in the implementation of the Social Health Insurance Fund. In response to these concerns, the Ministry of Health was invited on Monday, 10th February 2025, to provide responses to the issues raised as follows. Number 1, concerns that claims were taking too long to be approved, as well as delays on the activation of new registration, causing frustration among patients. In accordance with the SHE Act on claims processing timelines, providers are supposed to submit claims within 7 days of service delivery and processing by SHA within 90 days. SHIF claims worth 12 billion, that is 75%, submitted between 1st October 2024 and 28 January 2025 have been processed and paid to the providers. The remaining 25% comprises mainly of claims that requires clinical review. Those are being processed and payment shall be made immediately the process is finalized. Primary health care capitation claims worth 1.3 billion submitted between October to December 2024 have been processed and paid to the providers. In the initial period of the rollout, SHA encountered challenges of system readiness, necessitating use of manual claims. Further, there were non-harmonized bank details in the system, as well as delayed e-contracting, which are being addressed. In addition, the remaining claims that are awaiting filing of service delivery returns from facilities are undergoing reconciliation and payment process, which will be done immediately. In order to address these challenges, SHA has put in place measures to fast-track claims processing and payment, including enhanced automation to facilitate payment on a monthly basis. On activation of new registration, the activation of new registrations under the Social Health Authority is immediate once a member has registered and or made payments. There is no waiting period for accessing services at SHA contracted healthcare facilities. Once registered and paid up, SHIF members can access services under the following categories. 1, primary health care fund. This, you access services at level 2 and 3 and some level 4 facilities for outpatient services at no cost once registered as a member or a dependent. 2, on social health insurance fund, this is funded by the 2.75% contributions by both formal and informal population. Once paid up, beneficiaries are able to receive treatment from level 4, 5, and 6 facilities. 3, emergency, chronic, and critical illness fund. Currently, this fund caters for urgent care, that is resuscitation and stabilization within 24 hours for specific emergency services as per casseted benefit package for the initial 24 hours at no cost, since the fund is exchequer funded. Due to the current financial year funding limitation, the chronic and critical illness components of the fund are partially activated. These services are available in all level 2 up to 6 facilities for all Kenyans. On the second issue, Honorable Speaker, the sustainability of the Social Health Authority, given that 18 million people are registered, but only 4 million have made payments, and measures that SHA plans to take to cover the financing cap. Honorable Speaker, there is a disparity between registered persons, which is 18 million individuals, against the 4 million who are actively contributing financially. The financing cap has been caused by the following challenges. 1, low contribution rate. The core challenge is the low contribution rate, approximately 22%. This indicates a large portion of the registered population is not actively participating in the scheme. 2, informal sector challenges. The informal sector has a significant portion of the Kenyan workforce, estimated at 80% of the population. This presents unique challenges due to irregular income, limited financial literacy, and difficulty accessing formal financial systems. Reaching and retaining this group is crucial for sustainability. C, indigent population. Approximately 30% of our population are unable to afford contributions, requiring government subsidies. The mechanism for identifying and supporting indigents needs to be fast-tracked. D, compliance and enforcement. Ensuring compliance from both formal and informal sectors is essential. Effective enforcement mechanisms are needed to address non-payment and ensure consistent contributions. To mitigate these challenges, SHA has put in place a multi-pronged approach, including A, enhance informal sector engagement through sensitization campaigns, integration with county governments partnerships, informal sector organized groups, and other existing structures like SACCOs and chamas. B, engagements with the state departments for social protection and county governments for identification, budgeting, and payment of premiums to share for all indigent populations. C, strategic partnerships.
Hold on. Yes, Kagombe, Gatundu South.
Thank you, Speaker. Speaker, while the chairman of the Health Committee was on the floor, you declared a Kamukunji that was here illegal.
Yes.
While the chairman was on the mic, he announced that that is a party of Amunyoro meeting there. First of all, Speaker, this party is properly in this parliament. We don't have a party called Wamunyoro, and because this is a political house. Yes,
you are out of order. A point of order must be raised contemporaneous to the matter on the floor. Order. Pardon? Order. A point of order must be raised contemporaneous to the matter on the floor. He is not on that matter. Take your seat. Go on, Bukose. And I will encourage you, this statement, very important but very long. So give highlights.
Okay.
Yes. Give highlights.
Honorable Speaker, on C, strategic partnerships through cooperation with cooperatives, microfinance institutions, the diaspora community, NGOs, and donor agencies for insurance premium financing products. D, formal sector enhancement. E, enhance engagement with the Ministry of Health and the National Treasury for budgetary allocations for PHC Fund, ECCIF, and indigent premium for SHIF. Further, SHA is actively implementing the following activities to build upon and improve its performance. They are doing data-driven insights, incentive programs, payment systems, transparency and accountability, strengthening community engagement, and long-term financial planning, where they develop sustainable financial models that account for population growth, healthcare cost inflation, and economic fluctuations. On number 3, the requirement for out-of-pocket payments and its impact on access to healthcare. While SHA aims to reduce out-of-pocket healthcare costs, the committee noted concerns about instances where patients still incur expenses. To mitigate this, Honorable Speaker, the following activities are being undertaken. A, creating awareness and sensitizing the public on the applicable benefits and tariffs for informed decision-making in choice of facility. B, reviewing the benefit package and tariffs in collaboration with the benefit package and tariff advisory panel. And C, SHA will submit to Parliament a list of healthcare facilities where patients on SHIF contributions will receive a comprehensive payment without co-payment and with no co-payment. Honorable Speaker, on the difference between SHA and Taifa Care, Taifa Care is a Kenyan government initiative aimed at achieving universal health care, ensuring that all citizens access equitable, affordable, and quality healthcare services. The initiative focuses on 4 key pillars: sustainability of the healthcare financing, digitization of health systems, enhanced human resources for health, and security of health products and technologies. This program encompasses legislation measures designed to strengthen the healthcare system and reduce financial barriers for all Kenyans. Taifa Care components are Primary Healthcare Act, Social Health Insurance Act, Digital Health Act, and Facility Improvement Act as enacted by this House. On the other hand, the Social Health Authority, established under the SHE Act 2023, with the core mandate of pooling financial resources and risks and strategic purchasing of healthcare services on behalf of Kenyan people, towards strengthening health financing for UHC through management of 3 funds, namely Primary Healthcare Fund, Social Health Insurance Fund, Emergency Chronic and Critical Illness Fund. On the status of debts inherited by SHA from the National Health Insurance Fund and plans in place to clear them to ensure seamless service delivery. Honorable Speaker, this is a very important fact because the defunct NHIF owes healthcare providers an estimated 30.9 billion. Additionally, NHIF owes co-insurance Kenya shillings 8.137 billion for civil servants, wiper claims, and a further 3.97 billion in accumulated wiper claims before April 2021. NHIF also has outstanding premiums receivables totaling 25.5 billion across various government-funded schemes, including the Civil Service Medical Cover, Linda Mama program, and indigent support as annexed. These delayed payments have disrupted service provision, putting pressure on both public and private health institutions. SHA has been engaging the various MDAs with a view to recover the outstanding debts owed to NHIF to facilitate payments of debts to providers by SHA. Honorable Speaker, concerning the NHIF benefits were made favorable compared to SHA, despite SHA collecting higher premium contributions. SHA benefits have a wider scope of coverage compared to NHIF benefits. The contribution design for SHA is based on the solitary principle, where all persons contribute according to their ability to pay and receive similar benefits and tariffs. This is largely due to SHA's potential for larger pooled resources and risks enabling broader coverage and enhanced access to healthcare services. The SHA benefits ensures access to full spectrum of healthcare services from prevention, promotion, curative, rehabilitative, and palliative care. Further, SHA benefits are equitable, affordable, and accessible to all Kenyans in line with Article 43 of the Constitution. A comparison between NHIF and SHA benefits, we have an annex which I'll be able to table here. On the status of staff and whether they will be absorbed by SHA, Honorable Speaker, despite paragraph 1 of the Chief Act, where the Board of the Social Health Authority established under Section 4 of the Act shall competitively recruit and appoint staff under Section 17 of the Act, subject to the approved staff establishment and on such terms and conditions of service as may be determined by the Board. Notwithstanding the provisions of this paragraph, the staff are eligible to apply for the positions advertised by the authority and may be considered for appointment where they are suitably qualified for the positions advertised. Despite provisions of paragraph 2 and 3, the authority review the qualifications of all the staff of the fund and shall, with appointment of its staff, give priority to the staff of the fund who are found to be suitably qualified for the positions in the approved staff establishment. The staff of the fund not appointed to the authority under paragraph 2 may exercise his or her option to either retire from public service or be deployed within the public service. Currently, on the status of update on the NHIF staff transition, Honorable Speaker, the SHA Board has since sought the advisory of both the Attorney General and the Public Service Commission on staff transition. On 21st November 2024, all 1,737 staff of the defunct NHIF were taken over by the Public Service Commission and subsequently deployed to SHA for a period of 6 months or until when SHA completes recruitment, whichever comes first. The SHA Board has since reviewed the HR instruments and submitted the same to PSC for approval. Suitability tests scheduled to commence before end of February 2025. On concerns that data captured by SHA is inadequate, frustrating patients seeking treatment, and measures being put in place to ensure data accuracy. Honorable Speaker, the data captured by SHA is adequate to ensure provision of service. However, there are challenges faced by patients and measures to address them are ongoing. Further, the authority noted that some Kenyans do not complete the registration process, especially those that only register through USSD, code *147# channel. This group of Kenyans have not gone through the means testing process that enables them to make payments under SHIF and are not eligible for SHIF services in level 4, 5, and 6. On the lack of medicine in hospitals where patients receive treatment but are not given prescribed medication, Honorable Speaker, the Ministry appreciates the challenges of health products and technologies, and KEMSA business model was disrupted in 2019-2022 to the impact of COVID-19 health products and technologies. The procurement of COVID-19 HPDs during 2019-2020 period significantly impaired the authority's cash flow. Additionally, the authority has been burdened by significant receivables amounting to more than 6 billion as detailed below. As such, the organization's sustainability model has been facing various challenges, including inadequate financing to procure HPDs with a funding cap of 5 billion. Debt repayments by among them being the county debts amounting to close to 3.5 billion, with more than 2.7 billion over 90 days old. Counties work with KEMSA in generating forecasts for what is stocked at KEMSA. However, when it comes to procurement, they opt to buy elsewhere. The committee will be having a meeting with the KEMSA to develop a way forward. On this issue, Honorable Speaker, to support, we intend to improve HPT availability by recapitalization of KEMSA with a budget allocation of up to 5 billion to replenish deteriorating capital in order to break the various cycle of debt, pending bills, and low order fill rate. The National Treasury has so far allocated 1.5 billion to be factored in supplementary too. This will boost the availability of essential health products and technologies for universal health coverage. Additionally, the authority is engaging the county governments to pay long outstanding bills, currently standing at 3.5 billion. On a report on the public participation conducted before and after the rollout of SHA, Honorable Speaker, the Ministry has placed advertisements on print media on 28 November 2023, and the regulations were also developed and posted on official website. The analysis of the views and submissions expressed during the consultations and engagements indicated that the principal regulations, particularly the benefits package in the principal regulations, amended regulations, and tariffs for health services, will facilitate realization of universal health coverage in the country. A clear framework has been provided in principal regulations for the review of both the tariffs for healthcare services and benefits packages offered by the Social Health Authority under the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. On concerns that SHA branches are unable to adequately address customer challenges at the local level due to connectivity and system hitches, Honorable Speaker, system availability currently stands at 98.2% as at 7 February 2025, 12:38 a.m. Digital Health Agency is working to stabilize the system to meet targeted 99.99 availability. In order to address these challenges, the system configuration is ongoing with a target of completion by the end of February 2025. The agency is also fast-tracking the integration of existing hospital management information systems and claim management systems to further enhance efficiency in operations. This will improve system availability and experience for Kenyans. Concerns regarding poor public communication by SHA, Honorable Speaker, SHA is employing the following strategies: collaboration and partnership with other MDAs in carrying out public education and awareness, enhanced use of soft as opposed to hard information education and communication materials, leveraging on SHA branches network and Huduma centers for service delivery, partnership and support from development partners, working closely with grassroots leaders, including NGAOs, for enhanced communication, awareness and registration, and use of alternative media, including social media, to reach a wide spectrum of the population. On inadequate service delivery under SHA, Honorable Speaker, the SHA benefits package and tariffs, I'll be able to table them on this, and members can be able to go through it. On strategies that the ministry is implementing to ensure disadvantaged groups are fully covered under SHA, Honorable Speaker, identification of the indigent population through proximity testing as required by SHA Regulation 19 is ongoing, Honorable Speaker. And the government budget allocation for indigent will also be a boost to be able to make sure that indigent population are well taken care of. On coverage for pregnant mothers and teenage pregnancies, this is under Linda Mama program, which is still ongoing, that ensures pregnant mothers, including teenage mothers, receive full health coverage. This is effected upon first contact at the facility. Mothers who are due for delivery and have not paid the SHA premiums, the Linda Mama program automatically identifies and pays their annual premiums, covering the entire household Currently, the State Department for Medical Services is responsible for payments of the premiums. Honorable Speaker, on concerns that despite the high premiums, patients in need of services are being turned away by hospitals. Several issues have been identified where members, despite having made payments, are deemed ineligible as healthcare providers. These include incomplete payment records in the SHA database, absence of corresponding payment reference numbers, payments made via real-time gross settlements and RDGs, and electronic funds transfer EFT methods sometimes lack corresponding PRNs. This omission prevents the automatic updating of individual member amounts, leading to service ineligibility. On payment variances, Honorable Speaker, discrepancies between PRN amounts and bank payments. When the amount indicated on a PRN differs from the actual amount paid, the system cannot out-update the member's amount. This scenario necessitates manual intervention. Employers are required to upload detailed payment information, including employees' names and corresponding amounts, into the SHA system before remitting the payments. Then we have erroneous national identification numbers, which incorrect data entry, cancellation of payment registration numbers by employers. This also has an impact on employee eligibility. Then unprocessed payments. To mitigate this, Honorable Speaker, we have empowerment of branch officers, member service, self-service application, employer notifications, employer sensitization initiatives, development of information materials, simplified registration channels where we have accessible registration methods. USSD code, assisted registration, online portal, and physical locations where SHA branches and Huduma centers provide in-person registration service.
How much more do you have to go?
2 minutes.
Good.
On integration with the National Registration Bureau, Your Honorable Speaker, this is basically for data verification, data cross-referencing, and then, Honorable Speaker, measures the Ministry is taking to ensure the informal sector and the indigent populations are registered under SHA, where some of the challenges faced in informal sector registration in SHA include low awareness and sensitization, irregular and unstable income, and lack of formal identification. So what is SHA doing to mitigate this? We are doing mass awareness and sensitization, where you utilize community health promoters, vernacular radio stations, TV campaigns to reach informal workers in their local languages. This ensures widespread understanding of SHIF benefits and encourages voluntary enrollment. Crossroads roadshows, flexible payment methods. Under this flexible, we allow informal workers to contribute through monthly mobile money payments, e.g. M-Pesa, making it easier for them to afford and maintain coverage despite irregular incomes. Integration with SACCOs and chamas, partnerships with county governments, engagement with informal sector associations such as Border Association of Kenya, then insurance premium financing, where we collaborate with microfinance institutions and government funds like Hustler Fund to provide credit facilities for premium payments, ensuring affordability and reducing dropout rates. Targeted communication, where develop specific messages for the elderly, poor and vulnerable groups using simplified content and trusted community influencers to drive awareness and registration. Then we also encourage CDF budget allocation, where we advocate for constituency development fund allocations to sponsor SHIF premiums for vulnerable groups, and this is where the members come in, ensuring equitable access to health care. And then public-private partnerships, where we partner with microfinance institutions, NGOs, to extend healthcare loans for payments of premiums, and donor agencies like AMBAT and UNHCR. Honorable Speaker, the committee has also made our own recommendations, where we shall be engaging MOH and SHA in a retreat to look at the debts that are owed to the defunct NHIF, and will also engage them further as most of the issues such as the mean testing tool used in the informal sector, needs to be looked at to improve its reliability and accuracy through field visits and not online. Then verification of health services by quality health assurance officers with technical knowledge to detect and eliminate fraud. SHA has inadequate visibility and capacity to confirm if services being claimed by contracted facilities are rendered. We will also be looking at the benefits package under the primary health care fund, which needs to be enhanced. And also the State Department for Social Protection to leverage on the data provided by SHA and avoid subjecting the indigents to fresh mean testing. Honorable Speaker, the Public Service Commission has approved a staff establishment of 815 for SHA, and therefore the SHA board should follow the law as per the SHA Act 2023 transition clause in its recruitment of the staff. All former NHIF who will not be employed under SHA will be deployed within the Public Service Commission or exercise the right to retire under the Act. Honorable Speaker, thank you. I submit.
Thank you, Honorable Bukose, for that comprehensive statement. Yes, Chepalungu. Yes, there's one next to you. Okay, there you are.
Oh, yes. Thank you, Speaker. While we appreciate the efforts that our Chair Health has taken to give us that statement, and equally, while we appreciate what SHA has done, SHA has a very successful story, and particularly to one of my relatives, my aunt, who got injured, and 200,000 was required. We paid SHA, and in full, SHA paid all the hospital bills. And while we say the same, Honorable Speaker, there are situations that at times we wonder, some hospitals, or is it the SHA itself? Because there's a case of one of my residents, someone called Wilson Keter, who went to Karen Hospital for heart surgery, and on request for approval, out of 1.3 million that was required, only 78,000 was paid to this particular patient. And we as members of parliament, when we go to these particular families, they give us such questions. And in so, Mr. Speaker, I only wanted to comment on that and to seek further clarification on why in some particular situations, SHA pays the whole amount, and in some situations, like a case of Wilson Keter, who comes from Lelechonic Village, whom I attended his fundraising last week, SHA only paid 78,000 out of 1.3 million that was required for him to undergo heart surgery. Thank you, Honorable Speaker.
Thank you. Milemba.
Thank you, Honorable Speaker. As I appreciate the very comprehensive and long statement given by the Chair Health on SHA, especially the updates that we did discuss in Naivasha and other emerging issues. Honorable Speaker, I want to be quick to indicate that there are, as he did this, he should be able also further to explain some contemporary issues that are actually with us and which the Wananchi would want to know. Number one is the issue of the private hospitals. You know, as you give this very comprehensive statement, and I'm a statler follower of SHA, the private hospitals are on strike. That's how the language I can use given my background of trade unions. And you notice that that's affecting the communities and the society. I thought you should speak something on this. What is this correlation between the old debt of NHIF and how is it affecting now the operation of SHA to the extent that there are now some hospitals that are now not taking patients for treatment because of the old sins, if you may allow me to speak on that as the one of NHIF. Then there is also the informal sector. You know, the origin of NHIF, which SHA seemed to borrow from and we support, was the NHIF, and that one was founded basically by workers. The fact that the informal sector is not coming on board will really take us to a corner where we shall have a very small population trying to contribute for the entire entire country, and it will not work. So I want you to come out clearly on this, so that you explain exactly how we shall onboard the informal sector for this good SHA to work. Otherwise, we shall be in a situation whereby a very small population of workers are the ones who are contributing to the SHA, and this will not work properly. Otherwise, Honorable Speaker, there still need room for improvement. I want to thank the chairman, because at least the discussion is live and ongoing, but the registration may not be even as perfect as we would expect. Thank you.
Nikal.
Thank you, Mr. Speaker, for giving me this opportunity. I'm very grateful. I was supposed to read this, but I didn't. That was then, and this is now. Mr. Speaker, the report is actually, I'll support it, as read by our chair. It is basically an interaction between the ministry and SHA management and the committee, and the contents are actually correct. And it is mainly the effort of the ministry and SHA are making, which, as we know, have not resulted in the results that we all expected, and hence the outcry that we have. However, if you look at those efforts, the efforts actually look fairly reasonable, and if implemented, should actually be able to get us where we are. Now, what our committee has recommended is actually on the observations of those reports and what needs to be done to make those efforts yield better results. But of our recommendations, Mr. Speaker, the most important one is actually the retreat and the meeting that we are planning with the ministry and SHA management. Because, Mr. Speaker, the main problem that we have really noticed in all this is the management of change. It is the management of change which is a problem. The concepts may have a little problem, but not that much. And if you look at these areas of change, it's the liability and the assets that SHA took over from NHIF. And if you look at now, as it now, Mr. Speaker, the current problem we are having of hospitals actually closing up is related to the liability that SHA inherited from NHIF. So that is an area probably we should have looked at much better, because now, as we are very unhappy with SHA, ideally this is a transition issue, and it raises the question that what happened to the money that NHIF raised, and what happens with the debts then? So it is a change that we are dealing with. If you look at the area of registration, the registration for NHIF, Mr. Speaker, was straightforward. You registered as you paid. So every time you are registered, you are paid, and you could access the services. But what we have now, this registration has actually two components, two major components. You register, and if you pay, you are in SHA 2.7%. Then now you actually are liable to get, you can now get treatment under SHA, and things can be paid. But there's an element when you are registering and you have not paid, but you are still entitled to services at level 2 and level 3, for which we actually have to pay money. And what is happening is that even the little money that the government has put in has not been used because of structures that need to be put in place. So again, it is an issue of where things can work and are not working. The other one is the approval of services that people need and the payment system. The honorable member has just said in one case, the full payment was done. In another case, a very small portion of the payment was done. Again, it is because of you are dealing with two systems. One, if you are level 2 and 3. One, if you are in level 4, where you are in full SHA. And then also the benefit packages that are put in place, and depending in the hospital where you go. In some hospital, you will need co-payment or co-insurance. Again, these are things that they are actually in this system, but they have not come out well. The other area, Mr. Speaker, is the issue of human resource. To transit the human resource from SHA to NHIF, and as you can see, the numbers are so different, but all those people are there, although they are now all there as employees of the Public Service Commission who are now seconded to SHA, but these are not people who can work wholeheartedly, because only 800 out of the 1,700 are going to remain there, and nobody as of now knows who will remain. So we don't expect these people to work. So again, that is a system that we are dealing with. So Mr. Speaker, why I say this meeting is important, we as a committee then will have to look at this in fair amount of details in a more sober manner. And Mr. Speaker, let me say that in some areas, we may even have to look at the law. We did it very fast, it was desirable. But should we find that there is need for us to look at the law, we must be brave enough to look at it. Issues of capping, people have talked at, if you're paying 2.7%, depending on your income, some will pay as much as 30,000, some are paying. So when is the capping? So that is important. It's also, if you look at the area of informal pay, people in informal employment and indigents. So out of the 18 million people who have actually registered, only 4 million have paid. But now, in their own view, they think all of them, the 18 million, are entitled. Not all are entitled to all the services. And again, that is issue of communication, as my chairs have said. And therefore, that needs to be sorted out. And we haven't put in place properly the two groups that are remaining, the people in informal employment and the indigents for whom the government will have to pay. So the only people who are now clearly paying are employed people. So it's a huge population for now, just depending on a very small contribution. Mr. Speaker, these are things that actually be handled. We wanted to move fast. There's nothing wrong with the desire to move fast, and therefore, when we go to this, retreat, we should come back with recommendations, even if it means we retrace our path, we get some amendments we brought here quickly, let that be so. But Mr. Speaker, as of now, the population is not satisfied, but I think something can be done. Thank you.
Thank you. Wangari.
Thank you, Mr. Speaker. And I also want to laud the chair, because I remember in Naivasha, and thank you because you allowed us to have a very serious engagement in Naivasha. And that session is what necessitated this statement and the engagement we have seen. Mr. Speaker, I think Honorable Nyikal has raised most of the issues, but where I want to plug in is the need for intergovernmental relations to be put in place, because you find that the levels that we are supposed to get services, level 2, level 3, level 4 hospitals, are run by county governments. Then you find there is a level 6 hospital, like a referral hospital, say in Kenyatta. For someone in Nairobi, they would prefer to go to Kenyatta to get the first service, and yet they should get it at a level 2, but they know that level 2 or level 3, they will not get a doctor, or they will not get medicine. So, Mr. Speaker, I think even going forward, the ministry, even if they engage with SHA in the ministry, they must loop in the Council of Governors or the CECs at the county level, because these are the people who interact with these things every day, Mr. Speaker. That way, then we can be able to salvage what the issues that are not working, like Honorable Nyikal says, what should work and is not working. So I hope, Mr. Speaker, that in the next engagement, the county governments are given an opportunity. That way, they can be able to take care of their level 2, their level 3, and their level 4 hospitals, Mr. Speaker. Because ideally, we should be able to separate the issues of referrals to referral hospitals. That is to say, if you are going for ARVs, if you are going for immunization of children, malaria, flus, Mr. Speaker, they should not get their way to level 6 hospital. That way, we'll be able to decongest the referral hospitals for the very serious issues that have to be dealt at that level. But I want to laud the chair for the effort so far, and hope that the next round of engagement will have the county governments, Mr. Speaker. That way we'll be making progress.
Thank you. Majority Leader.
Thank you, Honorable Speaker. First, let me commend the chair of the Health Committee and all the members of that committee for the very good work that they did following your instructions in Naivasha. And indeed, they have, the committee and the the ministry officials have gone at great length, and listening to what the chairman has said and what Professor Nyikali is saying is indeed true, that there are many transitional issues that need to be addressed. But we can only encourage the management of SHA and the ministry officials to make sure that those transitional issues are sorted out and people are well informed ahead of time on the things they need to do, Honorable Speaker. Because if there's anything that has suffered from the negativity that we have experienced in the country, is SHA. And unfortunately, Honorable Speaker, as you have severally said in other fora, it's sad that even for us in the political class, we have contributed to that negativity and misinformation. Because it becomes very sad, Honorable Speaker, when you see a member of parliament stand up in public because they think what they will say to the public is politically expedient and popular with the public, and say things that they do not know whether this is Sha, She, or She, Sha, She, She, or Shu. Yet, what they are calling Sha, She, She, or Shu, Honorable Speaker, as a member of parliament, whether you sit in this house or the other house, because these laws, the 4 laws that we passed, were passed by members of parliament in both houses, Honorable Speaker. And there is not a single provision in those 4 laws that was not considered by this house and the other house and adopted. Therefore, it's very embarrassing, Honorable Speaker, when you hear a member of parliament saying, Sha, She, She, or Shu, yet you are part and parcel of the enactment of those laws. Honorable Speaker, leadership calls for what you have heard Honorable Nyikali say here, that there are issues, and what the chairman is saying. There are issues that the ministry and the SHA management ought to be addressing. Top among these issues, Honorable Speaker, is a question of pending bills. Honorable Speaker, if you listen to the conversation in the country on pending bills, you may imagine that pending bills are only there in SHA. Yet nobody is telling Kenyans that 99% of the pending bills in SHA are inherited problems from the old NHIF. 2, Honorable Speaker, nobody is telling Kenyans that out of the 19 billion that was inherited from NHIF, the defunct NHIF, by January, 9 billion shillings had been paid, and the pending 10 billion shillings are bills that are undergoing verification. Honorable Speaker, the chairman will tell you from the engagements with the Health Ministry and SHA management that quite a number of these bills are also fraudulent. But you know, Honorable Speaker, because corruption fights back, and when corruption begins to fight back, they are so vicious that their lies, their propaganda takes center stage ahead of the truth and factual information. And that's why I'm saying, Honorable Speaker, if there is anything the Health Committee can do for us, even as you consider the Supplementary Appropriations Bill, is to ensure that the SHA management has adequate resources to make sure that proper information is going out to the public, Honorable Speaker. Because it's embarrassing, Honorable Speaker, when I see even bishops pontificating on pending bills, as if even the faith-based hospitals, Honorable Speaker, that are owed by the defunct NHIF have just sprung up when SHA came into existence. And the same bishops who are pontificating, Honorable Speaker, are pontificating and telling us that you should not even be advertising what government is doing. Honorable Speaker, you know, when you are a bishop, you get to church every Sunday and advertise the good work of the Lord by preaching to the good people to convert and become good Christians, Honorable Speaker. It's the same for government. Government is the business of delivering services, and we are obligated by our own constitution to make sure that Kenyans have access to information and the right information. But I know some of these people, Honorable Speaker, pontificating out there, they are pontificating because they are pained by the truth that it is true, Honorable Speaker, that even within the faith-based hospitals, there are very many fraudulent claims that have been caught up
in the verification process. But because you want to pontificate and make Kenyans believe that government is not doing anything to address the problems that bedevil even the faith-based hospitals, Honorable Speaker, you want to make the whole world believe that since the advent of SHA, no pending bills have been paid. Yet, as we are saying, Honorable Speaker, out of 19 billion, 50% of those bills that have been verified have been settled. And it's only right, Honorable Speaker, to plead even to those of our bishops who are running some of these hospitals, as much as you may not like this administration, give them what is due to them. Give credit where credit is due. But also, as you pontificate about the fight against corruption, speak about corruption and fraudulent claims from the defunct NHIF also being perpetuated within faith-based hospitals, Honorable Speaker. Honorable Speaker, we've also seen this week, Honorable Speaker, the private health, the Association of Private Health Hospitals and the Rural Private Health Association call their members to go to strike, Honorable Speaker. Again, based on those pending bills. And I'm glad, Honorable Speaker, when I checked with the SHA management this morning, they were telling me, as of yesterday when the strike was on, 1,700 private hospitals, members of those associations, were already logged into the system and offering Kenyans services. And that's what I want to appeal to those who are running these associations. I know is the spirit of trade union and the politics of leadership of association to be seen to be agitating for things, but they must be cognizant that healthcare is not a matter that you can joke around with. It is joking around with the lives of Kenyans. Lastly, Honorable Speaker, in terms of being able to relay proper and accurate information to Kenyans, Honorable Speaker, I would want to encourage the Health Committee, the SHA Management and Ministry of Health, and that's why I spoke to the Health Committee to consider within the supplementary budget to enhance the publicity and advertising budgets for SHA. Because, Honorable Speaker, part of why Kenyans are being misled is because they have not been given factual information, especially around the space of the primary health care and the referral system. And this referral system, Honorable Speaker, if you go to UK, the NHS works under a referral system. But today, as Honorable Nyikal was saying, you'll probably find somebody has walked into a primary health care facility, his entire bill is settled, then they walk into a referral hospital and the bill is not catered for, not understanding that you begin from the primary healthcare facility to be referred to the referral through the referral system to a referral hospital or a level 4 or level 5 and 6 hospital. With that, Honorable Speaker, let me just say mine is to encourage the Health Committee to continue working with the Ministry and SHA management to perfect the imperfections that are there in this system, because this universal health coverage system is something that has been elusive in this country since the times, Honorable Speaker, when you served in cabinet under the able leadership of the late President Mwai Kibaki. And you know, Honorable Speaker, under Mwai Kibaki's regime, we attempted to roll out the universal health coverage, and it came to a cropper because of this negativity, Honorable Speaker. President Uhuru Kenyatta again tried, and again because of the noise and the negativity that you hear today, Honorable Speaker, he had to run away from it, and after rolling out in only 4 counties, I think it was Mombasa, Kisumu, Isiolo, and Machakos Onyeri. Again, it was abandoned. We have no luxury of time, Honorable Speaker, to now abandon the quest for universal health coverage at the altar of political expediency, and we must encourage President William Ruto, the SHA management, Minister in charge of health, and our own health committee to help the ministry and SHA midwife this process with courage, knowing that what they are doing is right, and right for Kenyans and right for this country, because at the end of the day, when you are assured of universal health coverage, every other Kenyan will live a peaceable, healthy, and productive life, Honorable Speaker. And I beg to support that report by the Chair.
Honorable Pukose, most of the 5 interventions have actually been complementary to the report. What you need to do is remain engaged keep having meetings with the management of SHA, with the ministry, and continue from time to time to bring appraisal reports to the House, whether requested or not, to keep the House and the country informed on the progress. I've read the report. You've actually teased out almost all matters of concern to the public, to members of this House, and even to the ministry itself, together with your colleagues like Dr. Nyikal, continue working on how to improve, but more importantly, communication to the public. Communication to the public, avoid unhelpful cynicism, so that members of the public can know where to go, what services to expect, and if there are challenges, because challenges will always be there in life. If there are challenges, how do you handle them? So that people don't keep on talking as if when there's a challenge, it means it's a failure. Challenge is not the same as failure. Where there are challenges, deal with them. So I will not necessarily invite you to respond. There are complementary statements to your statement so that we can be able to continue working on that. Next order. Yes, which are you addressing? Yes.
I take back that, Honorable Speaker.
Yes, Jared.
Honorable Speaker, times more than number. In this House, you've averred that this
Pardon?
House does not legislate in vain,
Yes.
nor present questions here to no end, much less the pronouncements of the Speaker himself. Honorable Speaker, a fortnight ago, you did direct the majority leadership to avail a report that is under the custody of public service as regards appraisal on hardship allowance areas, Honorable Speaker. Honorable Speaker, you did give only 5 days for response. We are now at a fortnight, and the report hasn't been availed before us. So, Honorable Speaker, during that day, whereas the majority leader, the substantive majority leader wasn't present, Honorable Baya was directed by you to pursue that report, bring it to this House so that you can give direction as to the next course of action. Fortunately, today, the substantive speaker is here present, our indomitable Honorable Kimani Chungwa, whom I believe has the requisite report to present before us, Honorable Speaker. Honorable Speaker, why I'm really pursuing this is because we have begun the budget-making process. And if you will so direct that those areas that need to be gazetted should be done so, then it will have a direct connotation on our budget process, Honorable Speaker. And any inordinate delay will only put us into more jeopardy as regards this matter, because we all understand the benefits that will accrue out of your pronouncement after the report is presented before the House. I thank you, Honorable Speaker, but I think the report ought to have been here much earlier so that whatever needs to be infused into our budget should be infused, Honorable Speaker, and I thank you for the opportunity.
Honorable Majority Leader, I don't know if you are listening to Jared Okello. The issue of classification of areas as hardship or non-hardship. There was supposed to be a report from OP that was to be brought. If you don't have it now, I direct that you bring it on Thursday afternoon. Do you have it now?
Honorable Speaker, let me get from the chair, because I've not seen him today, get to see if we can bring it on Thursday.
On Thursday. And the issue is, from what I hear from members, the random and erratic declaration of areas as hardship and others as non-hardship when they are in the same neighborhood or enjoying the same geographical topography.
And Honorable Speaker, it disadvantages very many people, especially professionals like teachers,
yes,
who work in those areas.
Yes.
I have the same issues also in my own constituency. In fact, I was telling the chair, even in my own constituency, there is one place, one location, one sub-location within the same location. One sub-location is a hardship area. Across
a road, the other side is not a hardship area. Thank you, Honorable Speaker.
Thank you. Thursday afternoon, Jared, you'll be here. Next order.
Order number 8, the Culture Bill, National Assembly Bill number 12 of 2024, second reading. Mover to reply.
Majority Leader.
Thank you, Honorable Speaker. Honorable Speaker, in reply, allow me to thank all the members. I know myself and yourself were away on Thursday afternoon, but Honorable Speaker, I was watching as this bill was being debated online. And we must thank the Parliamentary Service Commission for making it possible that even when we're out of the chamber, even on the roads, we can be able to follow what is going on in the House. And I must express my gratitude and thanks to the many members who contributed to this bill and appreciating the central role that culture plays in our society, and especially in an African society like ours, Honorable Speaker. Even with the emerging trends and changes, with the transformative things happening within the technology space, that many Kenyans and indeed many members who represent those Kenyans still appreciate the central role that culture does play in the lives of our people and seek to preserve that culture, Honorable Speaker. And I thank the members who contributed and the Ministry and the State Department for Culture for having drafted this bill that seeks to, among other things, Honorable Speaker, ensure that we are able to register issues that touch on culture and alienate the roles of the two levels of government, Honorable Speaker, those issues that will be catered for by the national government and those that will be catered for by the county governments, Honorable Speaker. Honorable Speaker, more importantly, the bill provides for the management of culture in Kenya, and as I said, alienates the functions of the two levels of government between our national and county governments, and also provides for the recognition and promotion of cultural expressions and indigenous technologies by public entities, something that has not happened in the past, the protection of our cultural heritage and expressions, and the protection of endangered communities and cultures. And Honorable Speaker, it's important because, and I was particularly watching to see how the Ma members of parliament, or those members of parliament who represent the Ma communities, would contribute to this debate, and I'm glad that a number of members did contribute. Because if there is a culture that has been abused over the years, is the Ma culture, Honorable Speaker, and I can see the Honorable Lenguris, because I know she's been very passionate on protecting the Samburu cultural practices, Honorable Speaker. And it's not just the Ma community where you find Kemani Ishongwa dressed up in a Moran shuka, donning the Moran hair, and pretending to jump like a Moran. And many at times, Honorable Speaker, many people making money out of the cultural practices of other people. This bill now provides for a mechanism.
Majority Leader, you may be interested to know, we went to London.
Yes.
And I think LHA was in that delegation for the 75th anniversary of the Commonwealth. And some very stocky Nigerians were brought and introduced as Maasai dancers. To pretend to be Maasais distorting Kenya's culture. So you should call upon our missions also to know who represents our culture out there.
Precisely, Honorable Speaker, and you have narrated that story to us in another forum, I think in the House Business Committee. And it's indeed true. One of the most abused cultural practices of the Kenyan people is a Maasai culture. And it's true, Honorable Speaker, you can imagine now in London, Nigerians pretending to be Maasais. Therefore, it's important even to have these cultures and certain cultural practices registered and known who are the property owners.
To make it worse, they're paid for it.
Yes.
For the pretense.
So that when you register your cultural practices, for instance, the Ma community registering their Maasai dances and their cultural practices, if anybody used to use that cultural property, they have to pay you for it. Otherwise, Honorable Speaker, you've seen even things like the Kikoi, Honorable Speaker, that was that was being done largely by Kenyans and a bit of Tanzanians, Honorable Speaker. The brand and the property rights for that Kikoi is with foreigners, Honorable Speaker, today. I'm told, Honorable Speaker, is an American who patented the Kikoi.
Yes.
And even by its very name, Kikoi is a Swahili name. This is part of the losses that we've been making, Honorable Speaker. We must also protect our culture from abuse by ourselves. Politicians, Honorable Speaker. You know, Honorable Speaker, we have seen politicians also abusing our own cultural practices for the sake of politics. Therefore, Honorable Speaker, when at times you see people trying to mobilize people, largely on the basis of their ethnicity, but hiding behind culture, Honorable Speaker, we must be in a position where both the county and national governments are able to protect cultural practices from abuse by politicians, Honorable Speaker. You've also seen other leaders or people who pretend to be leaders. Recently, Honorable Speaker, you saw the governor for Nyeri. You know, Honorable Speaker, when a governor insults an entire community, and again, unfortunately, it's a Ma community that was being insulted, that they don't wear, I don't know whether it's underwear or even trousers. But you wonder, when that governor discovered that Maasai males do not wear underwear, what was he doing, Honorable Speaker, you wonder? And how and when did he discover that there are people who don't wear underwear? And it's so embarrassing, Honorable Speaker, that can come from the mouth of someone who purports to be a leader. I know he has pretended to go and apologize to the Ma community, but, you know, Honorable Speaker, they say, birds of a feather flock together. You will understand why that governor for Nyeri would use such derogatory language against an entire community and a very culturally rich community of the Maasai and the greater Ma community, including the Samburus and the Rendiles, Honorable Speaker. And I want to encourage the Ma nation to continue preserving their cultural practices as they have done, and indeed all other communities in our country and in Africa at large, so that we do not allow our people and more so our young people to lose the values that we were raised up with, Honorable Speaker, because we are able to be taught our ways of life and not adopt the Western ways of life. Let us adopt the cultural, the technological changes that we will get from the West, but maintain our cultural practices, Honorable Speaker. And Honorable Speaker, let me just conclude by saying this bill indeed speaks to length on how we will protect those cultures, how we will safeguard our cultural practices from being abused, how we will protect our cultural properties from being stolen by others who do not even know and understand the value of those cultural property rights, Honorable Speaker. And I believe with the enactment of this bill, it will go a long way to protect ourselves as a nation and indeed as proud African people, Honorable Speaker. With those many remarks, I beg to reply, thank all the members who contributed up to very late in the evening on Thursday on this bill, and encourage them, those who did express the need to bring in amendments, when we take it to the Committee of the Whole very soon, Honorable Speaker. And with that, I beg to reply.
Thank you. Members on their feet, take your seats. Thank you, honorable members. I'll now put the question at order number 8, which is the Cultural Bill, National Assembly Bill number 12 of 2024, be now read a second time. As members of that opinion say aye. Aye. Will those of the contrary opinion say nay? The ayes have it.
A bill for an act of parliament to give effect to Article 11(3)(a) of the Constitution, to provide for the protection and promotion of culture and the cultural heritage of communities and for connected purposes. Order number 9.
Hold that before order number 9. I know the schools have left, but for the record, honorable members, because of what we are transacting, I was not able to recognize St. Gregory Koru Girls School from Horon constituency, Kisumu, was in the speaker's gallery. Honorable Koyo, I know you wanted to welcome that school. You are still allowed to go and welcome them within the precincts of Parliament out there. In the public gallery, we had Muthengera Primary School from Laikipia West, Laikipia. Ewangani Ema Primary School from Kajiado East, Kajiado. And Ndiaini Girls High School from Kurueini, Nyeri. Although they have left, we still record our welcome to them in the House of Parliament. Next order.
Order number 9, the Equalization Fund Administration Bill, Senate Bill number 14 of 2023, second reading, resumption of debate.
Member for Chesumei, I'm told he was on the floor. Is he in the House? Opportunity forfeited. Samuel Atandi, are you on the screen for this? No. Kuria Kimani, are you on the screen for this? Robert Basil, you already spoke. Get yourself out of the screen. Ferdinand Wanyonyi, are you on the screen for Equalization Fund Bill? No, get yourself out. Catherine Omanyo, get yourself off the screen. You want to contribute? You're on equalization. Go ahead.
Thank you, Mr. Speaker. This fund is supposed to reach every corner of the country where there is need, especially a place where it is semi-arid and arid, and places that receive floods. They deserve a lot of keenness to be supported all the time, because everybody here was born in a place. And if you were born in eastern, northeastern, northern part of Kenya, or Budalangi, or the semi-arids in Kenya, you did not apply for God to get you there. So all the places that deserve to get attention should be well funded adequately, yearly, with an intention to make that area attractive, like desert areas that we visit in Middle East. Otherwise, I don't think there's anybody who would love to be described as poor, severely poor, and always needy anywhere in this world. People have their own dignities out there, even if they lack now. If their situation or standards of living is improved, then they will also just not be waiting to be helped or be called or described as beggars. So this Equalization Fund, I support that it should in fact be increased, but wherever that fund touches, it should be progressive, yes, but we must see that actually a town, health centers, institutions like schools, just good roads that attract investors are constructed. Many investors are not attracted to places where there is poor infrastructure, and also where even getting a health facility that has real medicine is missing. So we need to make these places more attractive, better.
Hold on a minute. Hold on a minute. There's a point of order. Honorable Basil.
Thank you, Madam Speaker. I do want to interrupt my sister, Honorable Omanyo, but after checking on how she's dressed today, Madam Speaker, I don't think Honorable Omanyo has dressed within the parliamentary requirements. So I think that is inappropriate dressing. Thank you.
Proceed, Honorable Amaya.
My style of dressing is adequate. If you define properly well-dressed woman, look at me. I have a shirt that is well ironed, a windbreaker just in case of the cold, and a trouser that is good. It's fitting me. I have no problem if he wants to emulate my unique elements that are expressing my individuality. You should talk to me nicely to teach you how to dress. Yes, my dress, my choice.
Honorable Doyan.
Thank you, Madam Speaker. For Honorable Basil to say that Honorable Catherine, she's not properly dressed, he should tell us if he's used to with yellow color, so that, because we have very important things, Madam Speaker, to discuss, only to point out to a gorgeous white in color, you know, the best color that most people don't want to have in their closet. Next time, Madam Speaker, Honorable Basil should be put into task for wasting honorable members' time by bringing pettiness, opaque, null and void things before this hot air, before this hallowed house. And where are women, Madam Speaker? What is wrong with him? She's smart. Look at Catherine. He's asking, she's out of order. Maybe he wanted to be felt by his constituents that is in Parliament. He has been missing for the last 5 months. Thank you, Madam Speaker.
Okay, honorable members, let us proceed. Honorable members, let us proceed. Honorable Beatrice Elachi, you are contributing to this.
Thank you, Mr. Speaker. Madam Speaker.
Order, honorable members, let us proceed.
Thank you, Madam Speaker. And just to tell Basil, you know, you never tell a woman that she has not dressed well, unless you have admired something. Having said that, Madam Speaker, allow me to just go and support the Equalization Fund in terms of administration. But to say that, I'm also very sad that ever since I was a nominated senator, we have spoken about Equalization Fund, how we can administer, how we can deal with it, how we can support our people, because, Madam Speaker, when we had this in the Constitution, it was meant to ensure the areas that are marginalized have been able to be supported, especially by national government, so that the projects that were there and the projects that are needed, water and sanitation, health, the key projects that we knew, road infrastructure, that they are supported. But to date, every term of each parliament that we've been in since 2013, Madam Speaker, we have come back to relook at the Equalization Fund. But I am hoping now this will be the last and we shall be able now to administer and to ensure. But the good thing is that now we broaden, because there are many areas that are marginalized, Madam Speaker. It's not that just the areas and the countries we thought so. But what government should do is to look at every project, especially projects that cut across a whole county and another. For example, the health facilities that we are looking at, that we can be able to see government now supporting and ensuring that these projects are done. Remember, Madam Speaker, we had projects that were even done by CDF, and they were left when now we moved into devolution. And they've just been hanging, and we've spent public resources on this. So I think it is important, even as we talk about it, Madam Speaker. And when I look at the Senate bill, the proposals they are bringing in, number one is to provide now a framework of administration and management. And the other is provide for completion of projects under policies developed by the Commission on Revenue Allocation under Article 216. That means that this board that they are also proposing is a board that should come in and look at the different projects. But I'm hoping the advisory board can go beyond, not just looking, but looking across the country, where we've had projects that have used public resources, and especially that were projects of national government and were 80 to 90% in completion, should be completed so that people are able to use. So, Madam Speaker, even as, again, the Senate proposes there is an officer of administering the fund, which shall open a separate account at the central bank. I think that is where now, again, if we are not careful, you find yourself with challenges. For me, if I am asked, if you identify a project without bringing in a pending bill, the same way you run your GAF, Madam Speaker, the same way we run NCGDF, put in a committee in that area, let them have a way of running and ensuring that the money that has gone directly for that project. But if we put again money in an account, and then in this account we are saying, operate and maintain the books account, yes, consult again with the cabinet secretary, then that project will not move, Madam Speaker. We just need to have a committee in the area the project is in, ensure the money goes. Who is the mandatory signature? That is where now they have to rethink through the whole process and ensure the person who is a mandatory signature is a person who will ensure monies go directly for completion of each project that has been identified under this equalization fund. So, Madam Speaker, there are many things that we'll have to look at. But the question then we should ask ourselves is that after all this, shall we be able now to see the equalization fund going to these counties? And are we able to just see that in a few years to come, we shall be able to identify and say project X, Y was funded with the equalization fund, it is in completion, it is a model that you can see, and how is it now going to benefit the beneficiaries who are within those counties? So, Madam Speaker, the other thing we need to ask ourselves, even in that equalization fund, where we have electricity, is whether, for example, the last miles we are doing, since they are going through constituencies, do they really arrive into the counties and ensure that some of these projects are also being done in either way? But the report that comes in the House should now tell us, within this, the last mile was done, and the constituencies in an area that we identified that qualified for an equalization fund are now with electricity through this process. Then it is important in that report to show the counties we identified have also benefited. And so that issue of electricity is taken off from the checklist, and now we concentrate now on water and sanitation, concentrate on roads. Even roads, if you identify in those counties we say are in need of equalization fund, then the purpose of having trunk roads that cut across either the counties or the constituencies, again, when we have finished and we have now ensured it's in completion, why can't we have a report coming into this parliament telling us, based on the areas we ensured that they are under the equalization fund, we have now qualified and we have ensured they have roads, they have electricity, so that even when we come to the completion that was put in the Constitution, Madam Speaker, we are able to say, under this, the counties that were marginalized, they have improved on this, and the livelihoods of their people have also improved. Madam Speaker, when you look at one thing that we need to ask also, what the Senate says, functions of the county, the technical committee. So the county technical committee shall be responsible for approving projects to be financed, which is very critical. But then they say not more than 2 public officers designated by the county executive committee member with technical expertise in the areas of the prioritized projects. And then they come and say, not more than 2 public officers appointed by the cabinet secretary with technical expertise in the areas of the prioritized projects. So how I wish we had 2 from the county and 1 from the cabinet secretary, so that there's no duplication of this and this. At the county, yes, we need more. At the cabinet secretary, if he appoints 1, it will work better. And then they come and they say the chairpersons of the project identification and implementation committees with the sub-county and the secretary of the constituency development fund. It's a good technical committee, but then I will be wondering, the secretary of the constituency development fund. So each of them, and for this committee, because it has quite a huge number, to work properly, there is need of their roles to be really, in the regulations, maybe, Madam Speaker, their roles to be clear, so that they don't find themselves back and forth, and a lot of politics being played around in the same projects. We also have the board shall in every eligible county establish a project identification and implementation committee comprising of the assistant sub-county commissioner, who shall be the chairperson, the village administrators of the areas defined by the commission as marginalized, representative of women, youth, and persons with disability. So you find that the Equalization Fund has so many committees for it even to just deliver what is needed. So sometimes when you have such committees, just having that agreements to move is what will now again hinder the implementation of this. So Madam Speaker, while I support, I think there is need also to just look at it and ask ourselves whether we really want this fund to function. With those few remarks, Madam Speaker, I beg to support.
Thank you very much, Madam Speaker, for the opportunity to be able to contribute to this Equalization Fund and Administration Bill, Senate Bill number 14 of 2023. I want to say that this bill was passed by Senate about a year and a half ago, precisely 16 months ago, and it was awaiting for this House to be able to be debated and considered so that it can be enacted and passed into law. This fund was established by Article 204 of Constitution in 2010 and provided 1.5 of the audited national government fund as the fund to be used for the equalization purposes. This fund is a fund that was an equalizer, as the name is written, equalization. And this was supposed to address the areas that were marginalized by historical, let's say, injustice that were there before, and they were not being considered, and therefore they were marginalized. Some areas did not have even hospitals. Some areas did not have even little facilities like health centers. But this was an equalizer that water can be available and the roads can be available to those areas. And so the purpose was very good purpose, because for the country to be able to be governed equally, so that everybody feels that I belong to this country. When I was growing up, or sometimes back, I used to hear that some people used to say, when you go to Kenya, greet them. Meaning, they did not see any development that was being done as the other parts of the country. So they were saying, when you reach Kenya, just greet them and they say we are still around. I don't want to mention the areas, but we used to hear that in our area. So those are the areas that needed to be developed so that they can catch up with the others. And I'm sure we have seen a lot of developments in some of the marginalized areas, and the things have turned to be better because of this fund. The only undoing of this fund is the exchequer's delays, whereby the exchequer delays until another cycle of budgeting is realized. But the beauty of it is that the money does not go back to the exchequer. It does not go to treasury. It is retained the way NGCDF is retained. Once the NGCDF money is sent to the board, it does not go back. And this was crafted to be the same, to be administered the same. I must say that in my constituency, 23-24, we were given equalization fund of 13.5 million. And an hospital and a borehole in different places were earmarked for installations and implementation. And even up to now, the fund has never been sent to the count to be able to be channeled to my constituency. So there is a lot of delays whereby an amendment needs to be done so that this money, because it is mainly for some marginalized areas, like my constituency is the only constituency in Machakos County which receives equalization fund, can benefit from it. But the money has never come up to now. And even this year, the money has already been put again. But the 23-24 has never been wired to our area. So what I'm not saying, I'm saying if the money can be wired to the account of NGCDF through the board, if we can do an amendment, because that is a straightforward fund whereby it is managed by the fund accounts manager, and then the projects are identified the same way we normally identify our projects, then that can be an easy way of implementation. But if it passes through the county government, the county commissioner, then the money gets lost is there. You never know whether it will be able to be administered. So we shall keep on talking about this, but a further amendment is required on how the money should be channeled and where it should be channeled, so that the areas that the monies are budgeted for are not disadvantaged for a cycle of a full year without the implementation of that amount. The equalization fund can be a good equalizer in some areas. There are some areas I've been, when we have been going through the inspection through the NGCDF, and you find that those areas are properly marginalized. And yet, even the equalization fund is not being administered in those areas. So it should be done in a better way. The mapping should be done again, because there are some other people who have already even mapped their areas for equalization, which were not there before. So it has been abused somehow. So we need to be strict the way the equalization is administered so that all the marginalized areas can be able to get their share of the equalization fund. For those few remarks, Madam Speaker, I raise my case there.
Thank you. The Honourable Member for Turkana South, Honourable John Namoit.
Thank you, Madam Speaker, for giving me this opportunity to give my voice on the matter of Equalization Fund. Madam Speaker, the intention of Equalization Fund as per the Article 204 of the Constitution is to ensure that the marginalized areas, these are the areas that were marginalized by Sessional Paper number 10 of 1965. This paper, because the intention of this paper is to reduce poverty, ignorance, and diseases in this country. Secondly, it was to promote political equity, social justice, and human dignity, to promote equal opportunities, to enhance high growing income per capita. Madam Speaker, if you look at that particular paper, it removed all the resources, or it concentrated all the resources to productive areas of this country, leaving some areas of this country marginalized. And that's why the Constitution of Kenya 2010 brought in the issues of county governments, brought the matter of equalization to equalize these areas. And again, in addition to that, poverty was first reduced, or decentralization of funds was first realized when NGCDF was introduced in this country. That to say that the government has introduced a policy of bringing some areas of this country equal to these other parts of the country. Madam Speaker, I want to identify some gray areas in this equalization fund, and that's why this fund is in this House and it was in the Senate. First of all, the structure of governance of the equalization fund. Madam Speaker, if you look at the Constitution of Kenya, Article 204, it purely states from Article 2 to Article 4, 204, 2 to 4. It spells out very clear that this is the mandate of national government. But it goes further by saying that the national government can provide services, these basic services, either directly or indirectly to these marginalized areas. Madam Speaker, I want to state categorically, I want to be categorical that this is purely the function of national government that is delegated to county governments. Madam Speaker, if you look at public participation of this fund, initially it is the board which does public participation of this fund. But when the new structures, the four-tier structure of this equalization fund, that is the advisory board, equalization advisory board, county technical committee, sub-county technical committee, and project identification and implementation committee. These structures are pure. You cannot know which tier will undertake public participation. I want to state very clearly that I wish the fund will undertake public participation through the sub-county technical committee. Secondly, Madam Speaker, the funds for public participation are not remitted to the right committee because the administration of the fund is undertaken by the advisory board. So I request, when we prepare the regulation for this fund, we must make sure that the administration must go downwards to all the level or the three other structures. Madam Speaker, as a committee, we saw it is appropriate for us as oversight institution not to be included in nominating members of these boards. So we saw it wise, the Senate, because if you look at the previous law, it had given authority, the Senate, to nominate a member to the board. But for the current proposal, we are saying that the oversight board should not have any nominating power to the committee. Madam Speaker, there is bureaucracy. In the current state of Equalization Fund, we have seen bureaucracy. And to make this fund very efficient, we need to reduce bureaucracy. What the committee has done has reduced the 4-tier structure of Equalization Fund to tier structure, right from the advisory board to county technical committee, and finally to the sub-county technical committee. Madam Speaker, this fund has done a lot to these marginalized areas. For my constituency, we've done more than 30 projects under equalization for the FY 2023-2024. But Madam Speaker, again, the delay in exchequer releases of this fund. Up to now, the FY 2024-2025, no projects have been identified. And this is where the community that is marginalized in this country has not realized the value of this fund, Madam Speaker. Madam Speaker, again, if you look at the functions, the intention of this particular equalization fund, the first intention of this equalization fund, as I said earlier, is to make sure these marginalized areas, as I said, that sessional paper 10 of 1965 made some areas to be marginalized. That was the intention, to address that particular sessional paper. But unfortunately, this House, the leadership of this country, has mutilated the intention of this fund. If you look at the first counties, the 14 counties that were identified in the year 2013 to 2017, there were only 14 counties. But now, if you look at the beneficiaries of this particular equalization fund, it has gone even to Nairobi. Because the intention of the Constitution of Kenya 2010 under that Article 204 was not meant to dilute the 14 counties, the beneficiaries of the benefiting counties, that were only 14. But now this has been diluted, everybody is benefiting. The intention was not to address the emerging marginalization. That was not the intention of this fund. The intention was to address the matters raised by the article. That's only 14 counties. Madam Speaker, I urge this House, when this fund comes to an end, as envisaged in that Article 2046, I urge this Honorable House to assess the impact of this particular fund to see whether it has really addressed that kind of marginalization. And that provision is provided under Article 204(7). Madam Speaker, I beg to support the report by Finance and National Planning Committee. Thank you, Chair.
Thank you very much. Honorable Victor Quech.
Yeah, thank you so much, Honorable Speaker, for the opportunity to actually speak about this particular bill that is before this House. And Honorable Speaker, from the onset, I want to state that myself, as a member of Parliament from Chepalungu constituency, I support. And as to why I support, Mr. Honorable Speaker, is because this bill, the Equalization Fund bill, is seeking to bring or to actually do services, and services such as water, roads, electricity, and health facilities to the extent necessary for us as these marginalized constituencies to look or to appear that we are equal to other constituencies that are more developed than ourselves, Madam Speaker. Madam Speaker, this particular bill, equalization bill, has delayed because, Madam Speaker, the project were identified long time ago, and people have been asking us, members of parliament, on where this particular fund went to. I have a particular situation from a village called Cheptagum, where members were called into public participation, a particular village called Nogirwet, where members of public were called to attend a public participation, and after they did their report, several months, several are close to a year now, they are still waiting for these funds to reflect in the various accounts so that the project they identified can be implemented. Honorable Speaker, we speak about marginalization, and we applaud the drafters of 2010 Constitution for considering to bring at bar these particular counties and sub-counties. And as we seek to do the same, Honorable Speaker, we ask ourselves as members, is this what we are waiting so that as the constituencies that are below, that we cannot compare with other constituencies, can now be able to compete and to be compared with the constituencies that have actually developed immensely, Honorable Speaker? I am speaking bitterly, Madam Speaker, because when we compare rural constituencies with town constituencies, Honorable Speaker, we cannot compare. Their electricity connectivity is almost at 99%. When we go to the ministry, I was with you, Honorable Speaker, at Rerek office seeking for a few transformers. And as we go to seek for transformers, there are constituencies who are going to seek for streetlights, simply because we have disparities in terms of budget-making process in this House, Mr. Speaker. It is time we speak and to say that equalization fund, okay, it's good, it will at least bring some development. But, Speaker, is this development, is this equalization fund going to treat the inequalities that has been meted upon our constituencies for a very long time? A case in particular, Honorable Speaker, is where you find one constituency, and especially maybe my constituency, with a pending bill or with a pending road that are stalled for several years, and the budget allocates a very small amount of money, while it allocates these constituencies that have developed over years a huge amount of money. And as we speak about this, Honorable Speaker, we want to categorically state that we support this bill, and it is timely, it is urgent, and it is time that we pass it so that those of us who are suffering, those of us, these constituencies that are suffering, can be able to benefit from the same. But my sentiments on the issues that are touching on our constituencies will always remain the same. How I wish the 2010 Constitution, the drafters, would have gone ahead to even speak about the budget-making process in this House, Madam Speaker. Because if we continue sitting and if we continue treating the things that we see normally, this world is not going to treat us in a normal way, Honorable Speaker. I speak on budget, and I want to speak about it as many times as possible. Because if we can't speak about it, no one will speak on behalf of our constituencies. Honorable Speaker, I support this bill, and when the time comes, we will speak about issues that touches on our constituencies, and especially what is it that we have. How I wish 2010 Constitution was able to address, I wish it was able to address the way we make our budget, how we prioritize the project, how we then balance those constituencies that are still below, vis-a-vis the constituencies that are way above the others. How I wish the Constitution would have been able to handle such a variance, Honorable Speaker. Thank you so much. I want to say that I support, and as soon as this bill is passed, we would like to encourage the ministry or the treasury to be able to set aside this fund and to transmit this particular amount to the various accounts so that we realize and we see to it that what we had planned, that what the board had planned is actually done and the value for money is being seen. Thank you so much, Honorable Speaker.
Thank you. Member for Tigania West, Honorable Mutunga.
Thank you very much, Honorable Speaker, for the opportunity to add my voice to this very important debate on the proposed legislation in the management, concerning the management of the Equalization Fund. Honorable Speaker, the makers of the Kenya Constitution 2010 thought it wise to have Kenya developed as a unit. And that was really important. And that's why Article 204 of the Constitution presupposes or provides that we need a fund called Equalization Fund. This was upon realization that some areas of this country are not as developed as the others. And Honorable Speaker, this fund has been utilized sometimes in some areas, and there are testimonies in this House that this fund has done a good job. Honorable Speaker, the need to recognize that Kenya needs to develop as a unitary country was important. But Honorable Speaker, there is a dimension I would like to bring before I speak to the legislation or legislative proposal, which may have also led to discrimination in terms of factoring which areas need to be looked into. Honorable Speaker, I come from Meru County, and you tell anybody that Meru County may need Equalization Fund, they will tell you no, because they think Meru County is on top of Mount Kenya. Mount Kenya has all the water that you imagine, or on top of Nyambene. In fact, we have trees or we have twigs that are chewed, Mira, and you might think that Meru really does not require Equalization Fund. This is the reason why we in this House pushed for the formula to stop recognizing counties but go further to recognize sublocations. And the exercise that followed, Honorable Speaker, was to try and see whether Equalization Fund can be spread further and leaner. My constituency is called Tigania West, and Tigania West borders Isiolo County. And for all practical and theoretical purposes, Tigania West is ASAL to a large extent. When you look at the Equalization Fund and the formula that is used, and especially the content of the formula or the content that is used to develop the formula, the people of Tigania West are considerably marginalized, or they are considerably locked out of this Equalization Fund. One of the parameters that they look at, Honorable Speaker, is proximity to a school. If you look at Tigania West, people have occupied every available piece of land, whether it is arid or semi-arid or dry or desert. They have occupied everywhere. So they are living everywhere in the county. Now, if people from Isiolo can get Equalization Fund, and people from Tigania West cannot get Equalization Fund, then there is a problem. Because then our problem is lack of land. That's what we could say, because we have occupied all parts of the countryside. The idea is that in some areas, you realize there are vast tracts of land that are not occupied. And therefore, when people pass through those areas, or people who live in those areas, the hika living from such areas, then the parameters used, for instance, proximity to a school, proximity to health facilities, proximity to watering point, motorability of the roads, and so on and so forth, then they qualify. But you cannot have a people living in all parts of our countryside and without a school, because they need to educate their children. But Honorable Speaker, what you need to look at is, what is the nature of the school? How improved is that particular school? I have schools which are really in pathetic situation, despite trying to bring them up. And CDF alone is not enough. And the effort that is being put through by the Ministry of Education is also not enough. So Equalization Fund is important in some of these areas. When we proposed that these areas be looked into, and a team was sent from headquarters to go and reassess, they used the same formula, and therefore the exclusionism. So we were again excluded from being factored as part of those sub-counties or other sub-locations that require Equalization Fund. Equalization Fund is important because if you look at Meru County, for instance, most of the parts could be developed. But if you look at Tigania West, maybe parts of the other ASAL, sub-counties are not developed. And there is a serious problem. But what I've said is that you cannot have people living in an area without water, so they have to try anyway to get some water. They may be accessing water because they are living there. They are not just grazing and moving around. They are living there. They occupy because they are farmers. They are not grazers. They are not hunters. They are basically cultivators of the land. On the other hand, when you look at health facilities, they may have some makeshift health facility. Not really high standard, not really quality health facility. When you look at the watering points themselves, some of them are just improved dams or improved water pans, and then we can call such watering points. So we need to dig deeper into checking whether really we do not need to reconsider areas for purposes of equalization. Right now, what you are trying to do, if you look at some of those areas, they can rarely cultivate a crop because rainwater is not enough, or rainfall is not enough to bring a crop to maturity. People living in some of those areas, like I have the lower Kianjai, and then the other one around most of it, okay, as part of Akede, 3 wards that have been that are really marginalized, and therefore you have a serious problem. So we need to revisit the formula and ask ourselves whether having makeshift health facilities is good enough. Having some watering point, which is not even clean water, is good enough. Being unable to, living in an area and probably having a school which is not up to the standard is good enough. They don't need to be excluded. Honourable Speaker, the other issue that I would like to bring into consideration, and many members have spoken to this, is the management of the fund itself. And the legislation, the proposed legislation comes in to try and moderate the management of the funds themselves in view of identification of the projects that are supposed to be done in an area. In terms of prioritization of these projects, identification has to do with public participation. In most cases, you realize that the public participation that is conducted sometimes lacks credence in the sense that it's not exhaustive and is not overly inclusive. When it comes to prioritization, we need to ask the people themselves exactly what do they need. Then there are other issues that also come in. Initiation of the projects, vis-a-vis the availability of the money. In some cases, we realize that exchequer releases have been an issue to a certain extent in this country. And members have actually complained that the Equalization Fund is not working because of the projects that have already been initiated are not progressed at the expected rate. They take quite a while before they can be progressed to maturity and also to closure. So we need to, this legislation, the legislative proposal is needed so that we can be able to moderate, especially the committees that have got to sort out issues of identification, prioritization, initiation, project implementation, and also the monitoring and evaluation of some of these projects. The management aspect of the fund itself is an issue that needs to be revisited. On the other hand, Honourable Speaker, the amount itself is 1.5% of the budget. And when you look at the vastness of this country, 80% of Kenya is ASA. We need to revisit the issues. Or do we want to maintain people doing business in a way that they may never be able to be fully sustainable? What I'm trying to talk about, Honourable Speaker, is that we have more or less maintained the kind of animal that we've been having since we became habitants of this country. What I'm trying to say is that we've not really considerably improved the animals. Especially when you look at the northern rangelands, which include part of where I come from, the Isiolos, the Samburu, the Marsabit and so on, and also northeastern. Those animals have not changed. They have not been impacted upon by the genetic, pool of the country. Animals in the southern rangelands could have changed, but on the northern rangelands have not changed. So we need intensification so that we will be able to bring AI services to the people. Because we need to think about, AI services for people to use. The idea is, can we avail this water so that we may be able to now make sure that these animals are found in centralized places, and then you can be able to improve on the quality of the animal. The most important thing is the turnover. It's not really following the animals forever. And it's actually the having an animal that will get to market weight at a good age. You don't have to keep an animal for 10 years for it to get to market. It needs to be kept for maybe a maximum of 3 years. We have countries in this world, which are developing countries like ours, which are doing 18 months to get a 500 kilos of an animal, live weight. we should be able to do that because we are properly endowed scientifically and we have what it takes. We have our whole Kenya Kenya Animal Genetic Research Center, which is quite equipped. And this can help us to get our animals where we want. So equalization is important, even as we look at the lifestyle and we look at the utilization.
Thank you. Time is up. Honorable Samuel Moroto.
Thank you very much, Madam Speaker, for also giving me this opportunity. Where I come from, sometimes back during colonial time, it was a closed district. And that's why the Kapenguria 6 were taken to that place, because nobody could come from this area to that place, because it was closed totally. Then, after independence, this other issue, sessional paper number 10, 1965, came in. Up to 2010 is when we saw the light at the end of the tunnel. Madam Speaker, like I've also said, during that closed time, when West Pokot was a closed district, we got only missionaries who came through Uganda, not even Kenya. The Catholics came and settled in a place called Tartar. It is through those missionaries that lifted that area to where it is now, and they are still there, operating. In fact, in Tartar, we have a girls' national school, secondary school, doing very well. Then the Protestants came and settled in a place called Nasokol. In that place, we have also a wonderful girls' school, the secondary school, and primary, and others. And the word of God spread all over. Then also the Muslims came from Uganda, not even Kenya. Now that we were considered by good Kenyans who are doing the 2010 constitution, remember that there are also Kenyans suffering somewhere, like this, the ASAL regions. Madam Speaker, there were 14 counties, as somebody have said here, and they were given timeline for only 20 years to improve and come to the status where the others are. It's unfortunate now that there is nothing going on. We only dispatched it because I was there. I was just still a member of parliament. This is my 5th time to be here. The people were called for public participation. And West Pokot, all of them came to a place called Mutelo Hall. And then others to other places. And we agreed some areas to be improved. We were considering even schools, because like myself here, when I started class 1, 1972, I went class 1 to class 4. I was taking my lessons under a tree with those problems. Sometimes the blackboard and the books were flown. Then we ran returning the books. Coming back, it's already noon. We just sing. Just sauti ya mama kwaheri mwalimu. Everything remained under that tree. Now when this equalization issue came up, we really prayed and thanked God that God has given us good people, good leaders who can listen and say there are some areas who are suffering. Now it is not working. Okay, we don't care if they can extend. And then by getting that 28, 34, 38, even to 40, even all the way to the 47 counties, it's not an issue to me. They are Kenyans. If there are some places where they are suffering. But we need also to increase the amount that goes to this kit so that they can cover these other areas. I'm a teacher by profession. And I've been with people for a long time, seeing what they are doing. That's, Madam Speaker, my prayer is as leadership of this House and also Kenya. Let us be considerate and ensure whatever is given to these people gets to them. It's unfortunate now that the counties are now brought in. You see, there's a problem. Like you can get a road, the county government puts money there, and then they came again and claim that this one is for equalization fund. then there is no proper administration on this one here. That's my prayer, that we need to go down, especially the committee in charge of this. Let's go down and see what is happening. Otherwise, I'm happy that my colleagues, especially most of them, as from the time we began, they are really talking. And let us give this spirit so that we can see the lives of our people, of Kenyans, improved. And then again, the last, because I don't want to take time here.
What is out of order? Honorable Moroto, hold on. Honorable Chair.
Honorable Speaker, maybe perhaps is more of a point of information to my senior, that by the time the bill is coming for second reading, we already did public participation. We received views of the members of the public, and that report is actually available in this House, that actually public participation has been taken on this bill.
Honorable Moroto.
Thank you, Chair.
Your duty.
Yeah, I agree with you. This young man is doing well. I've been with him severally. In fact, we were outside this country, and he was doing well. And this is some of our prayers that we have to keep this leadership. Sometimes later, they can come and assist us. Thank you, Speaker. Madam Speaker, I just want to wind up to the leadership of Kenya and here, that things are not going well. As I said, I've been here. This is my 5th term. I served Moi, I served Kibaki, all the way to this one here. But now things are changing. It's not like it used to before. I come from Kitengela here at the river. There is this cement factory. There is a lot of problems now there. And I'm asking the Committee on Trade to visit and see. There are 2, what we call the MDs, appointed and cassetted. So it is a tug of war. Everybody has a friend in this corner. The other one has a friend in that corner. Thank you very much.
Very well. Honorable Member for Baringo, Jematia Sergon.
Thank you so much, Madam Speaker. I like the way you've just mentioned my name. It reminds me of the days we used to be in campuses as with you. Thank you, Madam Speaker. I also want to aid my contribution to this bill. And first of all, I want to congratulate the committee for very well elaborated document as a report. And members who have contributed have also given a lot of weight on this issue of the Equalization Fund and the Senate bill that came back to us now. And this is actually giving this document a good weight for the counties that are beneficiaries of this Equalization Fund, and Baringo is one of them. So far, we have been allocated some monies, and the constituencies that are benefiting in my county are around 4 or 3. That is mainly Tiati that got some sizable amount of money. We have Baringo South and Baringo North, and also Mogotio. These are the areas that have a very dire need in terms of amenities. That is very basic, that water, schools, that is largely in sparsely populated areas. Madam Speaker, as you also know that this bill is coming at a time when we are trying to recorrect the colonial errors and bad administration that was in this country long time ago, immediately after independence, on the paper number 10, that actually sidelined and gave a lot of weight in some specific areas that is already having resources that can build itself, and leave the larger part of Kenya, specifically the largely sparsely populated area. Now that we are here, and I want to say what Honorable Moroto said, that leaders of today and going forward are going to be so keen in making sure that the utilities and the money that has been allocated to these areas must be well utilized. And again, as the committee has put it very well, they have given us the board
the people who are going to be sitting and distributing these monies, all the way from the counties. The Senate is also involved, and the constituency level. These are people who are going to determine the projects that is going to be being implemented using this equalization fund. Madam Speaker, I also want to say, during the framing of the constitution or enacting this constitution, the allocation fund had a timeline. And Article 204 of the constitution says that the allocation of the money, this money was given a sunset of around 20 years. And this is, if I quote Section 6, and that says this article lapses 20 years after the effective date, subject to Clause 7, which Clause 7 says that Parliament may enact legislation suspending the effects of this clause for further fixed period of years, subject to the Clause 8, which again means that legislation under this 7 should be supported by at least members of the Parliament and the Senate at the county. And this one is a very crucial article for me, Madam Speaker, because I am looking forward to another legislation to give another leave of life in this equalization fund, because the equalization fund was not started at the right time, or the disbursement and enactment of the bill, because there was a lot of push and pull within Parliament and the Parliament and judiciary that kept these monies for very long, and that is why it was started to be disbursed the other day. And if you look at the country today, I don't want to predict that in the future there will be more counties that is going to be beneficiaries of this money. But if you look at equalization does not also mean that it's only on the arid and semi-arid areas. We also have areas like even in the upper cities, or the cities like Nairobi, where you still have very marginalized people in the mostly in informal sector. You know, these are people also should be considered going forward, so that it doesn't look like we are only looking for these monies to be beneficiary for people who are very far. But while we are looking at Nairobi, for instance, and now that the population and people are moving towards cities and urban areas, it should also be considered that we need to categorize. And when we will be doing this further legislation, we want to understand who is marginalized in the society. It does not only mean that when you don't have water, that you are marginalized. You can have water, but you are marginalized in many other areas. We also have to look at where, in the amenities that we build, whether we will strictly build schools that are able to take care of children or people with living disability. And these are could be considered as equalization, so that the society is able to be equal in many ways. Otherwise, Madam Speaker, because most of our members have also contributed much, I want to say I am going to be very keen as we enact this bill going forward. Thank you, Madam Speaker.
Thank you. Member for Njoro, Honorable Kathambi.
Thank you very much, Madam Speaker, for granting me this opportunity so that I can contribute to the Equalization Fund Amendment Bill. First, Madam Speaker, allow me to thank the team, which has been led by our able colleague. And Madam Speaker, just allow me to go and just do some comment. Equalization Fund is very important in this country. But my observation, Madam Speaker, this money should not only be meant for the arid and semi-arid areas, because there is also some culture and also some thinking that sometimes it is only arid and some arid which might be purely in need of this equalization fund. And Madam Speaker, why I'm saying that this money, why I'm proposing this round, I wish the Commission of Revenue Allocation should go beyond and also feature some other areas in this country. It is because though it was traditionally meant for the marginalized areas, there are some areas in this country which actually have a lot of challenge. And Madam Speaker, let me give just an example. Sometimes when people have not visited some part of Rift Valley, including your constituency and my constituency, Joro constituency, they won't understand why we are saying in the future, let the Equalization Fund also be purely to bring fairness to other Kenyans. And Madam Speaker, if you can, you have come to part of my constituency, Joro, I have some areas which are dry almost every year. We have a lot of challenges where people don't even get food when others are harvesting these countries. If you can visit a place called Naishi Kilo, Mahiga, somewhere called Kiajoya, you go to some areas like Kamngei, that is Nemauche, you again extend to a place called Piave, that is in Joro constituency. You will be shocked the way people are suffering for lack of water, the way people are also having a lot of challenges on matters on food insecurity. And Madam Speaker, as I stand here, let me say, this year when I was going to launch some schools, I went to lobby for some food so that I could have given to some specific schools because of the challenges they have had. Therefore, when we are talking about equalization, I think the Commission of Revenue Allocation, when they are planning for the priorities of the project, let them also go beyond and see other constituencies which have not been considered previously. And Madam Speaker, the Equalization Fund, I think what should be most be emphasized, it is, can we come up with the right project and the right cost of the project? Can we have also the timeline for the project completion? Can we also be having proper management of the funds of the equalization? And Madam Speaker, why I'm saying it should be extended to majority of the constituencies, like my colleague has raised also who come from Rift Valley, which has not benefited from this equalization. It is because if it is going to be considered, we also expect even a lot of irrigation project to be initiated in some areas where we are also affected. And when we are saying that we have so many arid and semi-arid areas with who have not gotten basic needs like water, the health, the roads, in some of our constituencies, like my constituency is one of the largest constituency in Nakuru County, and when you see the challenges of roads network, the matters of electricity, it is a big, big challenge. Therefore, when we are talking about fairness and also the equalization funds to be distributed, it should be known that even some of our constituencies, we still have a lot of challenge when it comes to health matters, services, when it comes to the matters of electrification, when it is matters of water, when we are talking about roads, when we are talking about food insecurity. So that in the future, let us ensure that if we are to do mainstreaming of these funds, let also other areas which have gotten a lot of challenge be considered. Therefore, Madam Speaker, the Equalization Fund is very important, and we are proposing as also members of Parliament who have undergone a lot of challenges in our constituents, which have never been considered. In the future, let us think how we can do inclusion. Therefore, this is very important, and thank you for that time you have given to me. Thank you, Madam Speaker, for that opportunity.
Thank you very much. Member for Trans Nzoia, Honorable Sioi.
Thank you, Madam Speaker, for giving me an opportunity to also contribute on this Equalization Fund. And I would like to say that the Equalization Fund is a good fund that was supposed to meant good for the areas that are marginalized. And when I was going through this document, Madam Speaker, I realized the fund was a national government fund. And because there are some areas that are not marginalized as per se, but the levels of poverty are too high, it is important that we consider such areas. But again, when I go through the document, I realized the fund is being disbursed to the county government. I have a feeling, Madam Speaker, that this fund could be given to the members of parliament, because these are the people who are closer to the people. The constituency belongs to the members of parliament, and they will be able to know which part needs what and which part needs to be done for what. So, Madam Speaker, I want to support this report, and as my colleagues have said, it is important that this fund equalizes all the constituency, all the wards, and any other area that is a little bit lower than the other, so that we come to the levels all together to ensure that Kenyans get the services that other Kenyans are also getting the service. Thank you so much, Madam Speaker.
Honorable Umi, member for Mandera.
Thank you, Madam Speaker, for giving me this opportunity. Madam Speaker, Article 204 of the Constitution establishes the Equalization Fund. And why this fund, Madam Speaker, why it was established is to bring regions that were not developed at par with the regions that were developed. Unfortunately, the Equalization Fund is not what it was meant to be. We've seen constituencies saying that they have pockets of marginalization, so it has really lost its meaning and why it was created in the first place. And Madam Speaker, as you know, it has a sunset clause of 20 years, Madam Speaker, and we are at the 14th year. 6 years to the lapse and nothing to show for it, Madam Speaker. And that is unfortunate. Madam Speaker, if I speak about Mandera County, Madam Speaker, is behind in all forms of development, be it water, education, healthcare. So, and I feel that it's the members of parliament themselves that have let down the people they represent, Madam Speaker. Because if this is the 14th year and nothing to show for it really, and you have healthcare built with 3 million, 4 million, it doesn't really say what it was meant to be. So I would urge and say that at least each county that is part of these marginalized counties where Equalization Fund is being established, Madam Speaker, should have one big project that is impactful to the community. Not small things that really do not make sense, Madam Speaker. Madam Speaker, I support this report. I am part of the Committee of Finance and National Planning with my able chair seated here from 2:30 p.m. up to now to ensure that this bill sails through. And I commend Honorable Kuria Kimani for the good job he has done and he's been doing. Madam Speaker, I therefore support. Thank you very much.
Thank you very much. Member for Kuresoi South, are you on this one? You're on record, so we'll give Honorable Dorothy, who is still walking on the aisle.
Thank you, Madam Speaker. Madam Speaker, I too want to add my voice to this very important bill, Administration Bill, Senate Bill number 14 of 2023. Honorable Madam Speaker, I want to straight away go to this Equalization Fund. Honorable Speaker, this fund is equally very important for us as a country because it is speaking out to areas that have been left behind for a number of many years. Areas that have suffered historical injustices in terms of roads, schools, hospitals, water, name it, all the necessary amenities which would make life more comfortable for the people living in those areas. Honorable Madam Speaker, as this may be, it is a fund that is supposed to sort out it's a constitutional mandate that has been given to us under Article 204, which requires the government to use the Equalization Fund to provide basic services in these marginalized areas. Honorable Madam Speaker, it's very disheartening to note that in the 21st century, there are areas where roads have not been opened up. There are no access roads. You'd be shocked, Madam Speaker, that some areas, even when somebody passes on, people in that particular area, they are tasked to carrying the coffin on their shoulders so that the body can be taken to its final resting place. Honorable Madam Speaker, we have areas, mentioned areas in this country where we have women giving birth by the roadside because, Madam Speaker, the nearest health center is kilometers away from where they reside. Madam Speaker, we have areas where children don't know what electricity looks like. Madam Speaker, these are the areas we are speaking out to, and these are the areas that we are saying this fund is very crucial. But Madam Speaker, surprisingly, the areas that have been gazetted to benefit from this fund are not necessarily the only areas where this fund should go. Because, Madam Speaker, we have areas, other areas which have been left behind, but still they require this fund. However, Madam Speaker, we will not be selfish and say those areas should not benefit. All what we are saying is let there be a thorough audit when this particular committee sits down. Let there be a thorough audit so that we can be able to map out this country and see, other than these areas that are now benefiting, which other areas deserve to have this fund. Madam Speaker, I'll speak out to where this fund is going through the county governments. Madam Speaker, I will be moving an amendment so that this money goes to the NGCDF kitty. And Madam Speaker, I'm making this proposal because when I came to Parliament, I had an opportunity of serving in the decentralized funds. And Madam Speaker, without any fear of contradiction, I will say that I am a witness that NGCDF fund has been properly utilized in a majority of our constituencies. And in some of these areas, when you go and want to know what the county government has done with their funds, Madam Speaker, I want to say a resounding nil. So, Madam Speaker, I'll be moving that amendment, and I'm sure it will carry the day. Madam Speaker, I also want to say, let us also go back and do another audit on where this money was earlier disbursed so that we can find out if this money has been utilized in the right way or if money is just being given and people take advantage of the fund. Madam Speaker, also, I want to propose that as much as it's in the bill, I want to say, Madam Speaker, let us have uniformity in the way projects are being done in these areas. Because, Madam Speaker, it beats logic when you are given money to build classrooms and then the classrooms that are built are makeshift of classrooms. Then we will never move from asking for this equalization fund. So let us have uniformity in the way these projects are being administered so that at least we move from these areas completely, because you can never remain marginalized for life, Madam Speaker. But if we do things the wrong way, then these areas will be marginalized, and then again, we still continue calling for equalization fund, for the same purpose that has already been done. Madam Speaker, let us look at the percentage in terms of development from these areas that have benefited, Madam Speaker. And Madam Speaker, I really want to say, if this fund is properly utilized, then it will be even a game changer in terms of sustainable development, Madam Speaker, because it will promote environmentally friendly and equal inclusivity of all the areas in this country in terms of development. Madam Speaker, I want to speak out to the areas like Nairobi, where we are assuming that the area is very, very well developed. Madam Speaker, we will see that there are pockets of areas which require this equalization fund. However, I want to route the government of Kenya the better program, because like the housing projects that the government is undertaking, this housing project will be a game changer in most of the areas because it's giving equal opportunities to everyone. Citizens will be able to own houses, decent houses which are affordable. So, Madam Speaker, the government is doing its part. Let also the people who are the people who will use this money, Madam Speaker, utilize it in the best way possible. Madam Speaker, I want to say we have countries like Australia where they have equalization fund, and when you visit that country, Madam Speaker, you'll be able to see what this fund is doing to bring people closer. So the inequality gap will be lessened if we use this equalization fund properly. Madam Speaker, I also want to say, let this money also be disbursed in a very timely manner so that people don't vet projects, people don't sit down, do public participation, and then at the end of the day, they finish 2, 3, 4 years before this money hits their accounts. Otherwise, Madam Speaker, I strongly support this bill and say, let us relook at other areas. There are areas like in Meru where we are in their need of this equalization fund. Thank you, Madam Speaker.
Thank you. That brings us to the end of that debate. Mover, Honorable Kimani, mover to reply.
Thank you very much, Madam Speaker. From the onset, I would like to thank the many members that have made very, very good contributions onto this bill. We like the proposals made by Honorable Dorothy and Honorable Sergon, Honorable Kathambi, and all those, Honorable Umi, and all those good contributions that have been made on this bill. And my advice is, as we'll be coming to the committee of the whole House, please liaise with the clerk's office so that you process those amendments, and we will be happy as the sponsors of the bill, the Committee of Finance and National Planning, to make sure that we actually have a law that's going to be watertight, because what you've had, the problem with the Equalization Fund Act, it was declared unconstitutional by the court, so we are looking forward to have a piece of law that is watertight. Also to have a piece of law that balances the distribution of these resources, because as Honorable Ume was saying, we need to have these projects so that they're not so thinly stretched that the impact that they're supposed to do in bringing those marginalized areas at par with the rest of the country are not realized. Because what you've seen, Honorable Speaker, as I think it was Honorable Kaluma who was saying, when little money is allocated to, say, a water project in a big town, a big city, then or in that marginalized area, then the money is too little to really have a good impact. So we would rather have fewer projects that have an impact to the community. And what honorable members were saying, they also have a way of assessing the success of those particular projects, Honorable Speaker. But Honorable Speaker, another bigger debate that we should have, and I think this needs to be addressed better by the other house, the Senate, is there are some also areas that are marginalized because of political interests. Where you find some counties, governors, because they probably perceive a particular area, they do not have political support, they end up neglecting that area in terms of allocating resources for those projects. And unfortunately, even some of the NGCDF committees also neglect some of these areas. So in as much as we want to bring those areas that are marginalized at par with the rest of the country, I think it's also important that we have political goodwill of all the leaders and all those people that are assigned with allocating resources to our communities, so that we do not disadvantage some communities, we do not marginalize some communities because of our own political differences. And with that, Honorable Speaker, I beg to reply.
Very well. I will defer the putting of the question to the next appointed time. Next order.
Order number 10, the Insurance Professionals Bill, National Assembly Bill number 13 of 2024, second reading.
Honorable Kimani, today is your busy day. Could you move the bill? Oh, you had moved. I'm told it was moved and seconded, so I will start with proposing the question. Honorable members, I will then propose a question that the Insurance Professionals Bill, National Assembly Bill number 13 of 2024, be read a second time. We'll start with the member for Kitui Rural, Honorable David Mboni.
Thank you, Madam Speaker, for giving this opportunity. Let's say on onset, I support the bill because, of course, it's from my committee. And, Madam Speaker, this bill came to Parliament, in the 12th Parliament, and it was really, it was not well drafted, but the one which we got this Parliament, it was very good. And of course, we are also requesting the members to propose for amendments to make it more better. Let me say this. This sector is a very important sector in this country. It contributes 2.1% to the GDP and employs over 10,000 people, either directly or indirectly. And together with manufacturing, banking, and ICT sectors, they contribute around 53% of tax revenue. However, insurance penetration in this country still remains low. It is at 2.4%. The third lowest in sub-Saharan Africa, and below global average of 7%. The sector faces a lot of challenges. One of them is public perception that the insurance agents are conmen, and therefore people really don't want to take insurances. And uncertainties in the market,
and cyber security risk, together with the workforce inefficiencies, because some of the claims, they take too long to be honored. I have one which has taken like 3 months before I'm paid. And the last one is unfavorable government regulation framework, which has harbored the penetration of the insurance in the country. This bill is trying to address some of these challenges. And the main objective of the bill is to provide framework for regulation of professionals in the sector, to enhance the standards in the sector, and also promote professionalism and address certain concerns regarding professional misconduct in the sector. A lot of people fear this sector because people don't have, the people who are there, they don't have a very good conduct. The bill seeks to establish the insurance institution of Kenya. In fact, this bill is trying to establish two things. One, to establish Insurance Institute of Kenya, and also examination board, which will be doing regulating the exams, which are going to be taken by professionals in this sector. So in the case of Insurance Institute of Kenya, this body is going to regulate professional conducts and maintain level standards of services rendered by professionals in the sector. This is like equivalent to ISPAC, if you know ISPAC, whereby if professionals in the sector misbehave, they are going to be penalized and put in order. Part 4 of the bill contains provisions for the registration of insurance professionals, so that the professionals can be registered, and therefore their conduct can be monitored, and those who are misbehaved, they are going to be punished. There is also going to be a registration committee that will be mandated with the registration of professionals. That's what ISPAC does, basically. All the professionals who have done in accounting profession are registered, and they can be monitored. And the bill will help to promote the recognition of insurance professionals in Kenya and beyond, so that at least even those Kenyans who have they have the professional qualification, they are recognized like the way accountants are. The bill provides for examination board, professional examination board, which is going to be entrusted in preparing syllabuses and set up exams. Madam Speaker, when we are doing public participation, we realized that College of Insurance is the one which is which is actually setting up exams. And some of the courses, they are 2 weeks. So somebody starts wondering, if somebody like assessors, they go for 2 weeks and then they become professionals. Somebody started wondering, if somebody does an exam, a course of 2 weeks, how does that person become a professional? So these are kind of standards which we are talking about. So this examining body is going to prepare for syllabus and set up the exams, and also issue certificates for professionals, and promote a reconciliation of these exams, so that at least anybody who is doing this exam is recognized as a professional. Currently, as I said, there's no professional examination board for the sector. And this body, that means if the exams are going to be set here, somebody who has a college, a student who is taking courses in somewhere in Keses, or in Kitui Rural, or in Mwea, can take the exams in that college, because they are going to be the same exams for each and everybody for that particular course. So, as I said, I think this bill is very important so that at least we can be, the penetration of insurance can actually be enhanced, and the contact of the people working in the sector can be good, and people are not going to lose their claims as it has been happening before. With a few remarks, I support.
Thank you. Member for Kitui Central, Dr. Makali.
Yeah, thank you very much, Honorable Speaker. Honorable Speaker, I also join my colleague, Honorable Boni, in supporting this bill. And it's important that, Honorable Speaker, this bill is in the House today because you and me, you remember this was in the 12th Parliament. And you couldn't see the end of the day because the term of the 12th Parliament ended before the bill could be passed to be an act of Parliament. So how I wish that this time, Honorable Speaker, we'll be able to see this bill going through. This bill is very important, Honorable Speaker, and it has remained important for many, many years. It's only that we are doing this when, according to me, it's a bit late. This should have been done many, many years ago. And why am I saying that? Honorable Speaker, insurance sector in this country is a very important sector. And it plays a very key role in assisting the country even grow economically. And when you look at this bill, it captures some very critical areas of what needs to be done for us to have an effective insurance sector in Kenya. One of the areas is the institute, where we are saying we need to be able to say who is an insurance professional, so that by the time you are called a professional, Honorable Speaker, you'll have gone through some training, you'll have made some minimum hours of training for you to qualify to be called a professional. Honorable Speaker, this is one of the sectors where we have what we call briefcase insurance brokers, agents, and all that. And as a result of having this briefcase agents and brokers, Honorable Speaker, our people have suffered. Honorable Speaker, I'm sure if I were to ask you, or one of my colleagues here, how many people you know in your village who have either been involved in a car accident or have paid money to an insurance for something, either insuring against fire, and when that act happens, Honorable Speaker, it becomes an issue to get that money back or the payment for that particular insured item, Honorable Speaker. We have so many cases in this country. And this is basically because, Honorable Speaker, people are very good when they come to sell the policy. When they come and they want to talk to you, at the time of selling the policy, they use any language you can imagine so that you buy that policy. But once it comes to pay, it comes to the time to pay, Honorable Speaker, that's where now the war starts. And by this bill, Honorable Speaker, I see a situation whereby we'll be having professionals who will now be able to Honorable Speaker, to work professionally and get claims paid on time, because that is critical. The other part, Honorable Speaker, is important is the issue of the examination, which has been administered to these professionals, Honorable Speaker. Honorable Speaker, in most professions, there are minimum required hours you must cover in terms of lecture or hours, Honorable Speaker, for you to be qualified. And if you go to the ISPAC, if you go to the lawyers, if you go to the engineers, there are minimum hours. Unless you have achieved that, Honorable Speaker, you will not be able to be called a professional. And that's why, Honorable Speaker, in this country, we have seen some universities who attempted to offer engineering degrees being actually deregistered by the Association of Engineers because they were not able to meet the minimum hours. So the same way, Honorable Speaker, through this bill, we'll be able to have professionals who have gone through some minimum hours of lecturing so that they become professional. In that case, you'll be standardizing the training so that if I get trained in part of this in Nairobi, or I get trained in Mombasa, or I get trained in Kisumu, at the end of the day, I'll be called a professional because I've met the minimum. The other point which is important, Honorable Speaker, is the issue of having a data bank of who are the professionals. So that, Honorable Speaker, if you wanted to know who is a professional in this country, in the insurance sector, we can, I think through this bill, they will be able to have some place you can either by a visit or by a click of a button, be able to know who is a professional. That will help Kenyans in terms of trying to differentiate between genuine professionals and brokers, Honorable Speaker, because there's so much money in this sector that brokers are more than the professionals. I would want to see that situation reversed, Honorable Speaker, where we have more professionals than brokers. If we get to that way, Honorable Speaker, we'll be helping the country. So even as the committee looks at this bill and pushes forward, I wish, Honorable Speaker, as a House, we need really to allow time for this bill to be passed by this House so that it becomes an act of Parliament and it can really improve our insurance sector. As I conclude, Honorable Speaker, I also want to urge the Insurance Regulatory Authority, because we have that regulatory authority, Insurance Regulatory Authority, Honorable Speaker, in this country. We know they are doing a good job, but there are those gaps we are mentioning, Honorable Speaker, where people have been involved in accidents, they have never been compensated. People have had their houses burnt and they already insured their houses, they are never compensated. And even when you are compensated, it takes so long for you to be compensated to an extent that then it doesn't help anybody, Honorable Speaker. So how I wish that through the regulatory authority, Honorable Speaker, we could be able to help Kenyans get their claims paid in good time so that they don't suffer, because the reason why you insure is that you are covered, and in case of an emergency, Honorable Speaker, you can be billed out. So with those many remarks, Honorable Speaker, I once more want to support this bill and request the House, through the House Business Committee, to allow time for this bill so that during the 13th Parliament, this bill becomes an act of Parliament. I thank you, Honorable Speaker. Thank you so much.
Honorable Maingi.
Thank you, Madam Speaker, for giving me a chance to support as I contribute to this very important bill. Madam Speaker, the Insurance Institute of Kenya was formed in 1948, operated as an affiliate institute of the Chartered Insurance Institute of London until 2002, when it finally got registered as a society by the Registrar of Societies in Kenya. Madam Speaker, every year we send Kenyan students take away money from this country to London to pay for their exams in the Chartered Insurance Institute of London. If we recognize the Insurance Institute as a professional body of this country, we are going to have Kenyans register for their exams here. We are going to retain our money, and we are also going to have members of other countries, our neighboring countries, register with us and bring in their money into this country. Madam Speaker, when we have a controlled insurance sector, our insurance sector employs thousands of people in this country. In fact, we have more than 13,000 insurance players in this country. If we go back to the contribution to the GDP, the 6.7 that was contributed by finance and insurance, 2.4% came from the insurance from the insurance sector. Such a sector cannot go unchecked. If we talk of insurance penetration, there exists a direct and positive correlation between insurance penetration and economic growth. If we look at those countries that have a strong insurance penetration, they also have strong economies. If we look at South Africa, if we look at economies like the UK economy, the US economy, those economies have a very strong insurance penetration, a very high insurance penetration. That means that the uptake of insurance is up. It's more than we have in this country. And why? Just because we are not regulated and people have no confidence, our customers have no confidence in the insurance industry because of lack of regulation. If we have the Insurance Institute of Kenya as a regulatory body to regulate all the professionals, then we are going to increase the confidence level in this country, and we are going to have more partakers of insurance. Then we are going to have the insurance exams even provided by our TVETs out there, because they know that insurance, AIIK is going to be recognized and that the insurance body is recognized and that their exams are going to be recognized. Thus, we're not going to have people send out money, going to book for their exams all the way in London with the Chartered Insurance Institute. Madam Speaker, the role of insurance cannot be underestimated. Insurance, without insurance, serves to provide a provision for cash for investment through the financial markets, capital investments like the real estate, the banking sector, construction, and also to protect lives and properties of people. If we look at the bombing of places like the Westgate Mall, or even the World Trade Center, or even more recent, the attack of Parliament by outsiders, if there was no insurance, then we would not get back to operations as quickly as we would like to get back to operations. Thus, people get back to operations and people continue to work and the economy continues to grow. The role of insurance, again, insurance helps in creating employment and making nations even more prosperous, because people are going to invest and they are going to take higher chances. They are going to risk even more because they know in the event of anything, in the event that their businesses go under, then there comes insurance to compensate for their losses. That way, the confidence levels will go up and people are assured that there's insurance to take care of their businesses and even their lives. So with those few remarks, I beg to support this bill and to thank the Chairman for Finance for bringing it up for discussion. Madam Speaker, I support.
Member for Busia, Honorable Omanyo.
Thank you, Madam Speaker. This is a beautiful bill that is long overdue. Many of our people have lost their lives or have been rendered handicapped or have been mentally challenged after losing to some dubious, uncertified brokers or agents of various insurances. Some of them actually just con right away. They come with very nice language and say, if you pay this per year, in case of any emergency, you'll be taken care of. If you are sick, you don't have to worry if you have money in the pocket or not. In case of your demise, your next of kin and children, they will get all this compensation. And in case you are handicapped, you are paid per week or after every 2 weeks. So you get drawn into paying some money yearly or monthly, knowing that there is an assurance at the end of it. But as a country, we have to tie our string to the kite, where we are truly assured, where we know that insurance brokers or agents are satisfied. And in case of anything, there is an institution or a body that we go to and ask that so and so, agent number this or broker firm this came to us and we got insured by your body and this is what has happened. And if they have a record or a data of every professional insurance person, then it will be easier to track if anything happens, if you were conned or truly you were maybe given a particular insurance, and then now they see into it what to do in case of that. But what happens today in Kenya, many of these people especially have gone into the villages, into the towns, where people like bodabodas have paid, but when they get an accident, there is no compensation. They go to court and they find out that they were played, they were conned, they have nobody to run to, no institution to run to, and report. So as a nation, we have lost a lot into the hands of some, let me use maybe a harsh word, a con man or con woman, who came in the name of an insurance firm, but did not really mean it. They just took the money. And also some of these firms, knowing that they cannot be taken anywhere, they make sure that they don't compensate. It's like they make sure that they don't pay according to how they promise. So we need, because if I went to TSC, if a teacher misbehaved, if I went to TSC, then they will know what to do to that teacher. If it's a lawyer who conned me or didn't purchase what I wanted, maybe I trusted him, gave him money. If he eats my money, I'll go to LSK, and LSK will handle him. They will punish. They'll, if I go to nursing councils, they are orderly. But when it comes to insurance, which body, I'm asking, which one do I go to and say that this broker or the agent took my money and I got this accident and up to date? Because going to the courts, the long bureaucracy makes somebody just gets tired on the way and gives up. And that makes many, many people don't even trust these insurances. It has remained for only the upper class, and the upper class in Kenya are very few, maybe 10% of the Kenyan economy goes to the right few ones that are trusted. What I want here is an institution, a body that looks like LSK, but it's an insurance body. That looks like TSC, but it's an insurance body. A body that can give certificates to all agents that represent various insurance institutions. If they come with that certificate, then we can trust and do more and save lives, or not just deposit or keep giving to a place that is like, it's going just to, like they say in Swahili, kiendacho kwa mganga hakirudi. So it's a beautiful idea, but then what exactly do we do when we feel like we have been conned? Thank you, Madam Speaker.
Very well. Member for Keses, Honorable Ruto.
Thank you so much, Madam Speaker, for this opportunity you've given to me. First of all, on onset, allow me to thank my chair for Finance and National Planning Committee, Honorable Kimani Kuria, for spearheading and steering away to ensure this particular bill is here in the floor of the House today. It has taken a length of time, knowing that it has gone through a lot of rigorous process, more so stakeholder engagement, which I participated. And Madam Speaker, to say the truth, I think this is one of the sectors that has been lagging for quite some time. It is one of the sectors that has a lot of interest in it. There are many players in the chain of this particular business. Those who are coming together, organizing themselves into an association, into a company called brokers, are people who find out an opportunity in doing or in trading in insurance covers. And for any other reason, it has also established many regulatory bodies that, if you look at the objective of these particular regulatory bodies, has got no divine and definite focus on the people in it. And I want to say this, that this particular bill is coming at the right time, that the sector and the financial sectors in put together is crying to have a people with technical knowledge, with level of competence, that not only they can do the business, but more so they can provide advisory to the people. Where many people have been suffering from lack of understanding of kind of insurance covers to take, or policy to take for that purpose, to secure or to protect their interest in terms of business or even life. Why? Because anybody who finds an opportunity or lacks unemployment, because we all understand the level of unemployment in this country, like any other country in the world, is rising every now and then. Somebody wakes up today, he finds himself in the industry, or she finds himself in the industry just because it can give an earning at the end of the day. And what has happened there? It has caused a lot of chaos and confusion. Sometimes many people have lost their values, their monies, even what they thought they have covered the risk in it, because they were not guided well. Neither there are no clear instruments or tools that can confer confidence to this particular person. Madam Speaker, this particular bill today, whereas you can hear many people talk about the whole sector, it is a unique thing that is coming to organize the sector. Because a system minus people is a failed system. We've had many systems in place that has created a lot of levels, that has created a lot of confusion in those levels, and there is no way when somebody gets affected, you can have a clear body to run to or a person to go and bleed or to make your appeal on your case. But this particular bill, Madam Speaker, is going to put three major things. Number one, establishing an institute. This institute is tasked with an enormous role. The major role is to ensure that it puts up a people that are going to operate within a given standard environment. A standardized environment that is carried with legal framework that is able to guide this particular practice. The other issue is to give a definition of the person who is an insurance practitioner. Because what we've been lacking, unlike the other professions like accountant, where I come from, I'm a certified public accountant, where an accountant is defined by Accountants Act. And for this person to be an accountant, other than going through normal education, knowledge, and skills, this person has to be subjected through another training to ensure that this person is well established in the knowledge of this particular practice. To the level, after accomplishing that training through the Accounting Standards National Examination Board, CASNEB, that person is certified. And that person is subjected to another institute called ISPAC, where they are going to register, after also going to ensure that they have taken through proper training and test and ensure they have been subjected through a given practitioner, a given professional, until this person is well assured that he has knowledge enough to be able to deduce or to be able to discharge that particular duty. And for this purpose, on the Insurance Practitioners Act that we are bringing in through this particular bill, this is going to ensure that consumers, that Kenyans will have confidence in the people they engage. Look at the matatu sector, the way there's a lot of chaos in it. Some people have found an opportunity in it, and people lose a lot of money. We have an emerging issues like border sector, Madam Speaker, where we even don't understand how to evaluate the risk, because we have no people who have come up with a policy on evaluating a risk of a customer who sits spare without anything supporting. And they are moving in the same road with a lot of risk and vehicles. Many cases of accidents has happened. If you come to Motiching and Devarol, they even have a dedicated facility to address the issues. But if you look at the kind of suffering the families are going to go through, there is no insurance that is ready to take up those challenges because the sector is not organized, because there are no people to give us knowledge. One of the issues that, Madam Speaker, we have to appreciate that this particular bill is going to bring about is to ensure that Kenyan insurance sector can be standardized and matched within the national standards. So that any business or a Kenyan can have a business that is covered in Kenya and can be accepted even outside Kenya. Or anybody can come and take an insurance in Kenya and undertake the risk, the risk that has been undertaken and give the confidence for that business to take place. Because everybody will have a role to ensure that it's going to have linkages, have partnership, have liaisons with the other insurance body, and ensure that world standards also is brought back to the Republic of Kenya, so that Kenyan insurance sector is appreciated in the global, and that one will give a latitude of our country move forward. Another issue, Madam Speaker, is the issue of discipline. You realize most of these practitioners, some of them have been going scot-free, and they have been messing up around because nobody's checking on them. But this particular body will ensure that quality assurance is enhanced and proper supervision every now and then, and quality assurance being undertaken, follow-up every now and then. And not only that one, even the issue of continuous professional development trainings. Because this particular institute will ensure CBD is provided for the practitioners, so that where there are emerging issues in the sector, the practitioners have an opportunity to be acquainted with, and they ensure that they are able to discharge their duty in a manner that is able to befit the required situation at that particular moment. The other issue, Madam Speaker, it's about when we were in public participation, a little bit we had issues with the sector which has been existing, and they were feeling threatened that probably are we taking away the roles and their functions they have been doing, like the Kenya College of Insurance. They fear that probably establishing an examination body is going to take away their role. No, this particular bill doesn't bring about an institution or a college, but instead it's just going to establish a body, a board that is going to sit down and define and design the standard training and examination that the same colleges, not only the Kenya College of Accountants can do, College of Insurance can do, Kenya College of Accountants can do, any other institution can offer, any other private college can offer training, but the examination that is going to be set for every practitioner across the board within the country, and who knows even outside the country, because Kasnaba, I'm aware, they are training South Sudan accountants, Uganda accountants, and even sometimes even Tanzania, and both around that, that we subscribe together to the same formation. The other issue, Madam Speaker, probably is the concern of the people who have been in the sector for quite some time. There is a worry that how will the transition be? Now that this sector is being organized, mine is to call out that during implementation, we also need to get cognizant of the people who have developed the interest for quite some time, though they don't have the knowledge on how they are going to do, so that we have a soft way of adopting them into the system through training and giving them that opportunity. Because by virtue of being them there for some time, you cannot move somebody today. Now that you're going to regulate the sector, you cannot have this person and move out of the market. My concern is for the implementers to ensure they provide a proper transition mechanism so that those people who are already in this particular sector, they are going to be adopted, they are going to be onboarded in a manner that they are going to move on well. But nonetheless to say, I'm sure, again, it will provide a better mechanism to sieve out those who have been lying to the people, those who have been camouflaging as insurers, and yet they have not gone through training. May I not mention anybody, but we saw the other day some people giving names qualified for a given profession. But we saw an institution coming out stronger and say, look at this. We are not aware in our register, in our role of register, that so-and-so has been trained and has been qualified and has earned the name, duly named, that are given or that are reserved professionals for this name. And we saw everything change. Because if you are not careful, you realize this market will get confused, and in future we will have no people to be relied upon. So this particular one, I'm calling upon this one, and not only insurance. There are many other professionals that we need to look at. I'm also proposing a bill to ensure we also standardize banking sector, we standardize procurement sector also, because it's another area also that we've been looking at a lot of challenges on procurement, corruption. We also need to organize this. With that much I've said, thank you so much, Madam Speaker.
Very well. Member for West Mugirango, Honorable Mogaka.
I want to thank you, Madam Speaker, for giving me the opportunity to make a contribution. And as I do that, permit me to thank and congratulate our Chair of Finance for scoring yet another first for the 13th Parliament by bringing this bill that is going to go a long way to regulate one of the major players in the finance sector, an intermediary which has hitherto been not regulated. This law, Madam Speaker, is so key so that even if you are talking about life insurance, medical, property, personal accident, motor, all these insurances are offered as products in this republic in a market that is so porous that everybody carries themselves as an insurer. This proposed bill, Madam Speaker, will now define what a professional is in the insurance sector, whether a surveyor, whether a consultant, so that then we are able to assign responsibilities to the various practitioners in the industry as defined in Section 2 of this bill. In particular, and as a lawyer, we always say that when you hold somebody liable in negligence, they must have a certain level of qualification against which you judge whether they had reasonable knowledge of a reasonable person in that profession for them to carry a certain level of responsibility and liability expected of that kind of training, certification and registration. So until now, Madam Speaker, we have been operating in a market where salespeople in insurance carry themselves as insurance professionals, where they give advice to unsuspecting, vulnerable persons who enter into insurance contracts, which, Madam Speaker, you know, are always in very small letters, and many uninsured do not understand what contracts they have entered into. This bill now distinguishes who is an insurance consultant who can give you advice against which you can rely, and if you find that you have lost, then you hold that a consultant liable. It then also now makes it easier for whoever is a professional practitioner in the insurance sector to take a professional indemnity, so that in the event there is a claim against the advice they have given, then that person will also have an insurance cover that will cover the liability that will crystallize in the event that they misjudged the advice they gave to a client and that client lost money. Madam Speaker, all professionals in this country are almost now getting regulated. When I was practicing banking, I was a member of the Kenya Institute of Bankers. As an accountant, you cannot practice without being a member of the Institute of Certified Public Accountants. Even human resource practitioners have a law now regulating and defining who professionals in that sector is, and so are the marketers, engineers, medics, even teachers and people in ICT. So this bill was long overdue, and the insurance sector should be celebrating that this 13th Parliament has lifted them from a general market to a professional practice that now will ensure that we do not allow quacks to operate in that sector. Madam Speaker, through this bill, we will be standardizing both the qualifications, registration, and conduct of practitioners in this profession. And once we have standardized, that opens our gates to globalization, so that any insurance inquiry around the world can go into a website and establish what is it that is required to practice as an insurance professional in this republic. Otherwise, so far, we have been having very unscrupulous business people walking into Kenya, setting out brokerage businesses, using a license of a certain broker who is not practicing, and they continue doing business even when they are aliens in this country. This bill will resolve that problem and ensure that only licensed practitioners and qualified are allowed to practice in this country. I want to join and support the member for cases who said that as we introduce this bill, and I would suggest to the Chair of Finance, there is already a practice in the insurance profession in this country without this law. And therefore, if this law or this bill gets assented to, we need to inbuild the transition clauses that will not bastardize those who are already practicing in this economy, but give them a grace period for them to comply. Because that is how civilized countries and civilized nations like Kenya is always practice. And through these parliamentary proceedings, let those who do not have this kind of qualification start preparing for them, because we want all the time to put our country on the national platform, on a competitive edge, so that we can be active participants in the global financial market. I want to thank the chair and the committee, and I want to thank you one more, Madam Speaker, for making me voice. And I can't sit before appreciating the people of West Mogrango, to whom I'm forever grateful for giving me a chance to bring my brains to assist in formulating such legislation. Madam Speaker, I support.
Thank you very much. Member for Njoro.
Thank you very much, Madam Speaker. Once again, allow me to thank you for once again granting me to contribute to the Insurance Professional Bill 2024, which has been spearheaded by my neighbor in Molo constituency, where we border with Njoro, my constituency, for this fantastic professional bill. Madam Speaker, when I was looking with the presentation which is there, this is the bill which is going to make Kenyans to do work with a lot of confidence with insurance companies, because we have gotten a lot of challenge with what is happening in this country. And Madam Speaker, another thing which I appreciate with what the bill is talking about is the first question I'm asking. When Kenyans want to go and learn about the matters of insurance, where do they go? And Madam Speaker, when I see if Kenyans wanted to travel from Turkana, probably from Nakuru, maybe northern part of Kenya, maybe Pokot or Coast, the only place they can go for learning matters of insurance, it's only in Nairobi, College of Insurance. Therefore, Madam Speaker, what this bill is also trying to do, it is trying to make sure that Kenyans can be empowered in their different respective areas, that it allows that even the institutions we have in our respective constituencies, like the TVET, like the universities and other registered organizations on matters of education, they can also empower our Kenyans, making it easier for each one of us, of them. Therefore, Madam Speaker, another thing I've also realized what this bill is going to do, it is going to make it very clear on the structures and also make it simple for quick communication and also introduce good accountability. Because, Madam Speaker, we have gotten a lot of challenges in this country where Kenyans insure their properties, but when an accident has occurred, we find most of illegal and the brokers and also people we don't even understand where they do the operations from. We realize the last minute when Kenyans have gotten some challenges, then they can no longer be found. Therefore, Madam Speaker, this will really assist Kenyans to realize, to know whom they can work with on matters of insurances, because you have lost a lot of money, a lot of property through dubious also insurance firms. Therefore, we would love to have professionals, like the way we have marketers professionals. Myself, I'm a marketer. Therefore, we would admire to have such professionals which have are really guarded well in the law. And Madam Speaker, another thing I thought it will also assist Kenyans. I sometimes ask if Kenya was traveling to Uganda or to Tanzania, and probably there was an accident with a foreign vehicle in a foreign country, what would happen? Therefore, when I saw this bill, it's also making sure that it has covered professionals in Kenya and the East Africa region. I find it will assist us, Madam Speaker. And another thing also I have learned about it, it is because the same bill establishes the Insurance Institute of Kenya, which becomes a professional organ, which is really going to guide and to come up with the right procedures and the processes to ensure that there's also good conduct and also to install disciplines in this country. And Madam Speaker, why I seriously support it, I had also a challenge this year where I just wanted to renew my insurance. And by coincidence, where I was going, I did not even tell people whom I was. And I realized someone was even trying to come up like, we cannot insure your vehicle. There's a claim raised against your vehicle. And actually, it was a pure lie. Therefore, Madam Speaker, I am expecting this bill is going to make a lot of transparency also. It is going to ensure that there is a proper communication. There is also right information, because most of the times, another problem Kenyans have, it's where after you have gotten a problem, there is lack of right information, and sometimes there's a lot of hide and seek. Therefore, Kenyans suffer so much. For KK, Kimani Kuria, who has come up with this bill, we support it. Probably it is now our responsibility to find where we can improve it so that our Kenyans can benefit it. Thank you so much, Madam Speaker, for that opportunity. And this was good work by the committee, which has been led by KK. Thank you so much.
Thank you very much. Member for Elders, Honorable Kainan.
Thank you, Madam Speaker.
Madam Speaker, I'm a member of the committee, and this bill has come at a time when this country is faced with many challenges. Madam Speaker, the insurance sector plays a critical role in our economic stability by providing financial security against risks and uncertainties, and that is the very basic definition of insurance. In Kenya, Madam Speaker, and first of all, I must admit that I have an interest in this sector. It was the first sector that gave me an opportunity to earn a living when I left university. So it's an area that I'm very familiar with and I'm very fond of. Madam Speaker, in Kenya, the industry has witnessed a significant growth, necessitating the establishment of a robust regulatory framework to uphold professionalism and integrity and safeguard the consumers against many risks, Madam Speaker. Madam Speaker, this is an industry that has been associated with fraud, with many other illegal street activities. It's only fair that at this time, in this modern day Kenya, some of the critical activities in the sector must be predictable, must be measurable, must be practical, and must be value-driven. And this is one thing that this sector has lacked, and this bill attempts to provide this, Madam Speaker. And therefore, recognizing this need, this bill, this proposed bill, seeks to institutionalize the regulation of, or regulatory framework for the entire insurance industry professional, Madam Speaker, through a structured oversight mechanism. Over the years, many players in this sector have resisted, just like many other sectors, to come under one structured professional entity. And you understand the reasons, Madam Speaker. Madam Speaker, the proposed bill also represents a significant step towards strengthening Kenya's insurance sector by instituting a regulatory oversight, enhancing professionalism, and protecting consumers. Consumers, Madam Speaker, one of the principles of insurance, Madam Speaker, the 7 principles I must admit, is you must act in utmost good faith. Can you define this? Can you quantify this, Madam Speaker? In this modern day Kenya, it's difficult. Utmost good faith is one of the first principles. The second principle, Madam Speaker, is you must indemnify the consumer. That very person who has taken this cover. The other bit is, but it must also contribute to the welfare of that particular individual, that particular insurer, Madam Speaker. The other principle is it must minimize loss. That is why you take a cover. In case this happens, I must get this in return. For that to happen, Madam Speaker, both the insurer and the consumer must have some sort of an understanding. Previously, it was in good faith. Can that continue in this modern dialogue where artificial intelligence, where all sort of groupings have taken over the global business system, Madam Speaker? Madam Speaker, the other one is you must have an insurable interest. And this is why today in this modern day Kenya, that itself has been a debatable issue, Madam Speaker. Madam Speaker, addressing these implementation gaps, Madam Speaker, or reality gap, Madam Speaker, requires a robust, and of course, we must also admit that the public, the Kenyan public is so much, informed. The atmosphere is pregnant with certain expectations when we talk about the benefits of a certain sector. That expectation must be met by who? By the sector. Through who? Through the professionals. In what mechanism? Through a legally acceptable mechanism, Madam Speaker. And this is one thing that we have struggled to do, Madam Speaker. And therefore, what addressing this implementation gaps, Madam Speaker, requires a robust dispute resolution mechanism that will be crucial in realizing the full potential of having an insurer, Madam Speaker. These refinements, the bill can effectively, therefore, mean the essence, actually. And I want to commend those who come up with, those who have contextualized this brilliant idea, Madam Speaker, effectively transforms the insurance landscape, fostering a trustworthy, efficient, locally and globally competitive industry. And Madam Speaker, once this is done, it provides employment opportunities for many Kenyans. It contributes to the economic well-being, Madam Speaker. It also contributes to the capital growth and the wealth growth of the people of Kenya, Madam Speaker. And it makes Kenya an investment destination, Madam Speaker, because insurance attracts a lot of capital investment on what I can call hot monies. You must have had this. The individuals, Madam Speaker, or regions that have a lot of resources and are looking forward to areas where they can invest, Madam Speaker. And therefore, the bill provides regulation for insurance professionals. These professionals are just like other professionals. The lawyers have the Law Society of Kenya. The accountants have the accountants. Madam Speaker, the architects have the engineers have this. So the professionals in this particular industry who have resisted over the years come in under one professional entity. The bill cures by proposing to establish 3 critical regulatory entities, Madam Speaker. And these are the Insurance Institute of Kenya, the Insurance Professionals Examination Board, and the Registration of Insurance Professionals Committee, Madam Speaker. These entities will not only examine, will not register, will not only regulate insurance professionals to uphold ethical conduct and maintain industry standards, but will formalize structures that the practitioners are expected to adhere to in their everyday professional engagement, Madam Speaker. Madam Speaker, secondly, the bill also attempts to bring professional standards. You are not just every quack who has a piece of paper, who can go to the streets, talk to Sweet Talk, a motor vehicle owner, an individual who is struggling to have life insurance, a medical insurance, must meet certain professional standards. Meaning you are expected to undertake a minimum professionally driven, professionally centered, professional-oriented examination so that you understand the dynamics of that particular sector. So it's not going to be a free-for-all industry where every person is expected to carry a business card, a bag, and pretend to be an agent of any particular entity. And I'm glad that this has been proposed in the bill. And therefore, Madam Speaker, this being a financial sector, any financial sector, professionalism and adherence to ethical codes are paramount. And this is critical in this bill. Therefore, by mandating stringent qualification criteria and continuous oversight, Madam Speaker, the bill aims to elevate the level of confidence, competence, and integrity among insurance professionals to any other critical financial, Madam Speaker, profession. Therefore, once this is done, this in turn will foster confidence in the sector, reinforcing credibility, because I said one of the principles of insurance is to act in utmost good faith. I think this only happens in certain societies, Madam Speaker, and it's slowly waning because of the changing dynamics of the human race. And therefore, reinforcing the credibility of a sector that is largely driven by action in good faith, Madam Speaker. The other bit, the third component in this bill, Madam Speaker, is consumer protection. What safeguards do we have for the many vulnerable insurance seekers, Madam Speaker? And therefore, a well-regulated insurance industry directly benefits the consumer, Madam Speaker, thereby making the Kenya insurance industry not only competitive in Kenya, regionally, but also globally. And this is one status that Kenya has been attempting to acquire over the years, Madam Speaker. Madam Speaker, and therefore, this will minimize the risks of fraud